empowerment for women in our community. From routine checkups to specialized treatment, Pratheeksha is not just a place of healing, but a sanctuary where women can find solace, compassion, and the tools they need to take charge of their well-being. Welcome everyone to the new era of women's healthcare, Pratheeksha. I am Gayatri Devi, third year BSc Physician Assistant student, Amrita Institute of Medical Science. As we gather here today, let us take a moment to center ourselves in gratitude and reflection. Let us bow our heads and open our hearts to the divine power of prayer. I invite Sambhujya Swamini Karunamrita Prana for performing the puja. Now, we have a respected guest here for this auspicious occasion, and I heartily invite them to join us in the stage. I invite Dr. Sheila Nambiar ma'am, Mrs. Jebi Maitar ma'am, Dr. Radhamani ma'am, Mrs. P.G. Nair ma'am, and Dr. Priya Nair ma'am onto the stage. It's with great humility and anticipation, I extend my sincere welcome to Dr. Saridha Shekhar, Clinical Associate Professor, Department of Adult Cardiology, for welcoming the gathered. Welcome, ma'am.
Thank you, Gayatri. Good morning to all. Amriteshwariye Namaha. ഇന്നൊരു സാറ്റർഡേ നല്ലൊരു വീക്കെൻഡായിട്ട് ഈ ഒരു പ്രോഗ്രാമിന് വന്നിരിക്കുന്ന നിങ്ങൾ ഓരോരുത്തർക്കും ഐ എം വെരി ഗ്രേറ്റ്ഫുൾ. ഒത്തിരി നന്ദിയുണ്ട്. കാരണം ഇത് കുറേ വർഷങ്ങളിലൊരു സ്വപ്നമാണ്. നമുക്ക് വിമൻസ് ഹെൽത്ത് എന്ന് പറഞ്ഞാൽ എല്ലായിടത്തും പറയുന്നുണ്ടെങ്കിലും അത് പ്രാവർത്തികമാക്കാനും എന്താണ് അതിൽ കറക്റ്റായിട്ട് നമുക്ക് ചെയ്യേണ്ടതെന്നും കുറേ ദർ ആർ ഗ്യാപ്സ് ഇൻ ട്രീറ്റ്മെൻറ്റ്. അത് ഐഡൻറ്റിഫൈ ചെയ്ത് അതിനെ കറക്റ്റായി നമ്മൾ റെക്ടിഫൈ ചെയ്താൽ മാത്രമേ നമ്മൾ ആ ഒരു ഉദ്ദേശത്തിൽ നമ്മൾ സക്സീഡ് ചെയ്യത്തുള്ളൂ. അപ്പോൾ പ്രതീക്ഷ എന്ന് പറയുന്നത് ഞങ്ങളുടെ ഏറ്റവും വലിയൊരു പ്രതീക്ഷയാണ്. ഞങ്ങൾ ഒരു കൂട്ടം ഡോക്ടേഴ്സ് കുറേ നാളായിട്ട് ചർച്ച ചെയ്തിരുന്ന ഒരാശയം, അതായത് മരുന്നുകൾ മാത്രമല്ല, ചെക്കപ്പ് മാത്രമല്ല, കുറച്ച് ബ്ലഡ് ടെസ്റ്റ് ചെയ്യുന്നത് മാത്രമല്ല ആരോഗ്യത്തിലേക്ക് നമ്മളെ കൊണ്ടുപോകുക, കറക്റ്റായിട്ടൊരു ജീവിത ശൈലി അതെങ്ങനെ നമ്മളെ സഹായിക്കും, ആ ഒരു കോൺസെപ്റ്റാണ് ഇതിൻ്റെ പുറകിലുള്ളത്. അപ്പം ടെസ്റ്റ്, പാക്കേജ്, ഡോക്ടേഴ്സിൻ്റെ കൺസൾട്ടേഷൻസ്, ഇതിന് അഡീഷണലായിട്ട് നമുക്ക് നല്ലൊരു നോളജും അതുപോലെ തന്നെ ഒരു സെക്കൻഡ് നിർത്തി പ്രതാപൻ സർ ഒന്ന് സ്റ്റേജിൽ ഞങ്ങളെ ജോയിൻ ചെയ്യണം സർ, പ്ലീസ് സർ. അപ്പം ആ ഒരു ആശയം നമ്മൾ എങ്ങനെ നമുക്ക് പ്രാക്ടിക്കലാക്കി കൊണ്ടുവരാം, അതാണ് ഈ പ്രതീക്ഷയുടെ പിന്നിലുള്ള ഒരു എൻറ്റയർ മിഷൻ. അപ്പം ഇന്ന് ഈ ഒരു പ്രോഗ്രാം ലോഞ്ച് ചെയ്യാനായിട്ട് രണ്ട് വളരെ പവർഫുൾ വിമൻ ആണ് നമുക്കിന്നുള്ളത്. ആദ്യം നിങ്ങൾ കണ്ട ഡോക്ടർ ഷീല നമ്പ്യാർ മാഡത്തിൻ്റെ ഡീറ്റെയിൽ ആയിട്ടുള്ള ഒരു ഇൻട്രൊഡക്ഷൻ ഞാൻ പിന്നെ തരാം. ബട്ട് മാഡം ഈസ് എൻ അതോറിറ്റി ഇൻ വാട്ട് വി സേ ലൈഫ് സ്റ്റൈൽ മെഡിസിൻ. She is in fact the founder of Indian Society of Lifestyle Medicine. ഈ ലൈഫ് സ്റ്റൈൽ മെഡിസിൻ എന്ന് പറയുന്ന ഒരു എൻറ്റയർ ബ്രാഞ്ച് ഇന്ത്യയിലേക്ക് ആ ഒരു കോൺസെപ്റ്റ് കൊണ്ടുവന്നത് മാഡമാണ്. മാഡം ബേസിക്കലി ഒരു ഗൈനക്കോളജിസ്റ്റ് ആണ്, ബേസ്ഡ് ഇൻ ഊട്ടി. അപ്പം മാഡത്തിനെ മാഡം ഓർഡർ ചെയ്ത ബുക്സ് വളരെ 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 നമുക്ക് ഇറ്റ് ഗീവ്സ് ലോട്ട് ഓഫ് നോളജ് ആൻഡ് ഇൻസൈറ്റ് ഇൻ ടു ഞാൻ ഈ ഡിസ്കസ് ചെയ്യുന്ന കാര്യങ്ങളെ പറ്റിയെല്ലാം മാഡം എഴുതിയിട്ടുണ്ട്. അപ്പോൾ മാഡം ഓർഡർ ചെയ്ത ബുക്സ് ഞങ്ങളിൽ കുറച്ച് പേര് ഞാൻ വായിച്ചു കഴിഞ്ഞു, ഞങ്ങളിൽ കുറച്ച് ഡോക്ടേഴ്സ് വായിച്ചുകൊണ്ടിരിക്കുകയാണ്. സോ ഇറ്റ് ഈസ് റിയലി വർത്ത് റീഡിങ്. ഓൾ ദ ബഡിങ് നഴ്സിംഗ് സ്റ്റുഡൻസ് ആൻഡ് നിങ്ങളെല്ലാം അത് വായിക്കണം. അപ്പം മാഡം ഇന്ന് ഈ പ്രോഗ്രാമിന് വന്ന് സംസാരിക്കുകയും നമ്മളുടെ ഷീ ഈസ് ഗ്രേസിങ് അവർ ഒക്കേഷൻ, അത് നമുക്ക് വളരെ അഭിമാനമുള്ളൊരു കാര്യമാണ്. So welcome Sheila ma'am to our institution, and thank you so much for traveling so far and for helping us launch this program. രണ്ടാമത്തേത് ഞങ്ങളുടെ ഒരു പേഴ്സണൽ അഹങ്കാരമാണ് ജെബി മേത്തർ. നിങ്ങൾക്കെല്ലാം അറിയാം, ഓണറബിൾ മെമ്പർ ഓഫ് പാർലമെൻറ്റ് ആണ്, ഞങ്ങളുടെ കാർഡിയോളജി കുടുംബാംഗമാണ്, ഞങ്ങളുടെ കൂടെ വർക്ക് ചെയ്യുന്ന കാർഡിയോളജിസ്റ്റ് ഡോക്ടർ ഹിഷാമിൻ്റെ പത്നിയാണ്. അതുകൊണ്ടാണ് ഞാൻ പറഞ്ഞത് ഞങ്ങളുടെ ഒരു പേഴ്സണൽ അഹങ്കാരമാണെന്നുള്ളത്. 1.5 വർഷമായിട്ട് ഞാൻ ഇടയ്ക്കിടയ്ക്ക് ജെബീനെ ഡിസ്റ്റർബ് ചെയ്യും, വരണേ ഞങ്ങളുടെ ഈ പ്രോഗ്രാമിന്. ബിക്കോസ് ഐ ഓൾവേസ് വാണ്ടഡ് ആൻ എഡ്യൂക്കേറ്റഡ്, എംപവേർഡ്, simple woman to speak for women. So she is one of the most, I would think, I'm so privileged to have her here. ഈ ഇലക്ഷൻ്റെ തിരക്കും ഡൽഹിയിൽ മീറ്റിംഗ്സ് ഒന്നും ഇല്ലാതെ ഇതിനു വേണ്ടി നമുക്ക് വേണ്ടി വരാൻ പറ്റിയതും ഞാനൊരു വലിയ ഭാഗ്യമായിട്ട് കൺസിഡർ ചെയ്യുന്നു. സോ താങ്ക് യു സോ മച്ച് ജെബി ഫോർ അക്സെപ്റ്റിംഗ് ഫോർ ഇൻവിറ്റേഷൻ ആൻഡ് കമ്മിങ് ടു ഗ്രേസ് അവർ ഒക്കേഷൻ. താങ്ക് യു സോ മച്ച്. പിന്നെ സ്റ്റേജിലുള്ള നമ്മുടെ കുടുംബം തന്നെയാണ് ഞങ്ങളുടെ സീനിയറായിട്ടുള്ള പ്രതാപൻ സാറ്, രാധാമണി മാഡം നമ്മുടെ സീനിയർ മോസ്റ്റ് ഗൈനക്കോളജിസ്റ്റാണ്, നിങ്ങൾക്ക് എല്ലാവർക്കും അറിയാം. സാറും പ്രതാപൻ സാറിൻ്റെ കാര്യം പറയുകയാണെങ്കിൽ സാർ എപ്പോഴും എന്നെയൊക്കെ സാർ സ്വന്തം മകളെ പോലെയാണ് കൺസിഡർ ചെയ്യുന്നത്. സാർ എല്ലാ കാര്യങ്ങൾക്കും ഞങ്ങളുടെ കൂടെ തന്നെ ഉണ്ട്. ചെയ്യുന്നില്ല എന്നുള്ള വിഷമമേ സാറിനുള്ളൂ, ഇനിയും ചെയ്യൂ എന്നുള്ളത് മാത്രമാണ് സാർ പറയുന്നത്. അപ്പോൾ എന്ത് പറഞ്ഞാലും സാർ ഫുൾ സപ്പോർട്ടാണ്. താങ്ക് യു സോ മച്ച് ഫോർ ബീയിങ് സച്ച് എ ഫാദർലി ഫിഗർ ആൻഡ് ബീയിങ് വിത്ത് അസ് സർ. താങ്ക് യു സോ മച്ച് ഫോർ കമ്മിങ് ഫോർ ദ പ്രോഗ്രാം. മിസ്സസ് പി ജി നായർ മാഡം നിങ്ങൾക്കല്ല സ്റ്റുഡൻസിനൊക്കെ എപ്പോഴും അറിയാം, നിങ്ങളെല്ലാവരും കാണുന്നതാണ് നിങ്ങളുടെ ഇൻഡക്ഷൻ പ്രോഗ്രാമിലും ഒക്കെ. മാഡം നമ്മുടെ എല്ലാ പ്രോഗ്രാംസിലും മുൻനിരയിൽ തന്നെ ഉണ്ടാകും. മാഡം എന്നും ഒരു സോഴ്സ് ഓഫ് ഇൻസ്പിറേഷനാണ്. റിട്ടയർമെൻറ്റും ഏജും ഒന്നും ഇതേ അല്ല, ഇറ്റ് ഈസ് ഓൾ അബൌട്ട് മെൻറ്റൽ സ്ട്രെങ്ത്. എത്ര വയ്യെങ്കിലും മാഡം വർക്ക് ചെയ്യാൻ വരും. സോ ടു സീ ഹർ സ്പിരിറ്റ്സ് ആൻഡ് ദിസ് ഈസ് ഹൗ യു ഷുഡ് വർക്ക് ഇൻ ഫ്യൂച്ചർ എന്നുള്ളത് മാഡത്തിനെ കാണുമ്പോൾ എപ്പോഴും തോന്നാറുണ്ട്. താങ്ക് യു സോ മച്ച് ഫോർ കമ്മിങ് മാം. ആൻഡ് രാധാമണി മാഡം ഈ പറഞ്ഞ പോലെ എന്ത് കാര്യത്തിനും മാഡം ഫുൾ സപ്പോർട്ടാണ്. മാഡം പറയുന്നത് നിങ്ങൾ ചെയ്യണം, നിങ്ങൾക്ക് ഞങ്ങൾ സ്പേസ് നോക്കാം, അവിടെ ചെയ്യാം, ഇത് ചെയ്യാം, നമുക്ക് ഈ പ്രോഗ്രാം പ്ലാൻ ചെയ്യണം, എന്ത് കാര്യത്തിനും മാഡം ഫുൾ സപ്പോർട്ടാണ്. എപ്പോൾ വിളിച്ചാലും ഇത്രയും സീനിയർ ആണെങ്കിലും മാഡം ഫോൺ ആൻസർ ചെയ്യും. മാഡം എല്ലാ ഇൻപുട്സും തരും. ഈ ഒരു പ്രോഗ്രാമിൻ്റെ പിന്നിൽ മാഡത്തിൻ്റെ സപ്പോർട്ട് വളരെ പറയുന്നതിലും അധികമാണ്. താങ്ക് യു സോ മച്ച് മാം. വി ബീൻ ലുക്കിംഗ് ഫോർവേഡ് ടു ഗെറ്റിംഗ് ഫ്യൂച്ചർ ഹെൽപ്പ് ഫ്രം യു. താങ്ക് യു മാം. പിന്നെ ഒരു ഓഡിയൻസ് ഇല്ലാതെ ഒരു പ്രോഗ്രാം ഒരിക്കലും ഒരു സക്സസ് ആവത്തില്ല. എൻ്റെ ഹെഡ് ഓഫ് ദ ഡിപ്പാർട്ട്മെൻറ്റ് ഡോക്ടർ രാജേഷ് തച്തൊടിയിൽ സാർ ഞങ്ങളുടെ എല്ലാ കാര്യങ്ങളും ഞങ്ങളുടെ ഡിപ്പാർട്ട്മെൻറ്റിലെ എത്ര ഡിവിഷൻസ് കൂടുതൽ സ്പെഷ്യലൈസ് ചെയ്ത് ഉണ്ടാക്കുന്നതിലും സാർ എപ്പോഴും നമ്മളെ പ്രൊമോട്ട് ചെയ്തിട്ടേ ഉള്ളൂ. താങ്ക് യു സോ മച്ച് ഫോർ കമ്മിങ് സർ. സാർ വേറൊരു മീറ്റിംഗിൻ്റെ ഇടയിൽ ഇറങ്ങി വന്നതാണ്. താങ്ക് യു സർ ആൻഡ് താങ്ക് യു സോ മച്ച് ഫോർ ഓൾ ദ സപ്പോർട്ട്. പിന്നെ ഡോക്ടർ ഹിഷാം ഉണ്ട് ഇവിടെ. താങ്ക് യു സോ മച്ച് ഡോക്ടർ ഹിഷാം. ആൻഡ് മധുമിത മാഡം ഞങ്ങൾക്കൊരു ഗ്രൂപ്പുണ്ട്, ഞങ്ങളുടെ സ്വകാര്യമായ ഒരു എയിംസ് ലവ്ലി ലേഡീസ് എന്ന് പറയുന്ന ഒരു ഗ്രൂപ്പുണ്ട്. അപ്പോൾ അതിൽ ഞങ്ങളെല്ലാവരും വി ലുക്ക് അപ്പ് ടു സം സീനിയർ മാഡംസ്. അതിനകത്ത് മെയിനായിട്ട് ഒരാളാണ് മധുമിത മാഡം. മാഡത്തിന് ENTയുടെ വേറൊരു പ്രോഗ്രാം അമൃതേശ്വരി ഹാളിൽ നടക്കുന്നുണ്ട്, എന്നിട്ടും മാഡം വന്നിട്ടുണ്ട്. താങ്ക് യു സോ മച്ച് മാം. പിന്നെ ഞങ്ങളുടെ ഗ്രൂപ്പിൽ അംഗങ്ങളെ പാനൽ ഡിസ്കഷൻ സമയത്ത് നിങ്ങൾക്ക് പരിചയപ്പെടാം. ഡോക്ടർ പ്രിയയ്ക്ക് സ്പെഷ്യലായിട്ടൊരു ഇൻവിറ്റേഷൻ ഇല്ല, പ്രിയയാണ് ഇതിനെല്ലാ സപ്പോർട്ടും തന്നത്. ഡോക്ടർ പ്രിയ നായർ നമ്മുടെ ഈ സ്ഥാപനത്തിൻ്റെ മകളെന്ന് തന്നെ പറയാം. അപ്പം പ്രിയ ആണ് എന്ത് പറഞ്ഞ് ഓടിച്ചെന്നാലും നമുക്കത് ചെയ്യാൻ മാഡം, നമുക്ക് ഈ ഒരു ഐഡിയാസ് എല്ലാം കൊണ്ടുവന്ന്. അപ്പം പ്രിയയുടെ സപ്പോർട്ട് ഇല്ലായിരുന്നെങ്കിൽ ഒരു പക്ഷേ ഈ പ്രോഗ്രാം ഈ ലെവൽ വരെ എൻ്റെ ജോലിയുടെ ഇടയിൽ എനിക്ക് കൊണ്ടെത്തിക്കാൻ പറ്റില്ലായിരുന്നു. താങ്ക് യു പ്രിയ. ദാറ്റ്സ് ജസ്റ്റ് എ ഫോർമാലിറ്റി ഐ നോ. അപ്പം ഇനി നമുക്ക് മെയിൻ പ്രോഗ്രാമിൽ സ്റ്റുഡൻസ് നിങ്ങളെല്ലാവരും വന്നതിന് വളരെ നന്ദിയുണ്ട്. നിങ്ങൾക്ക് ഈ പ്രോഗ്രാം കൊണ്ട് ബെനിഫിറ്റ് ചെയ്യും. ഇനിയുള്ള ഒരു 1.5 to 2 hours നമ്മൾ ഡിസ്കസ് ചെയ്യുന്ന കാര്യങ്ങൾ കൊണ്ട് നിങ്ങൾക്ക് ഡെഫിനറ്റ് ആയിട്ട് നിങ്ങളുടെ ഔട്ട്ലുക്ക് ഓഫ് അബൌട്ട് വിമൻസ് ഹെൽത്ത് നന്നായിട്ട് മെച്ചപ്പെടും. താങ്ക് യു സോ മച്ച് കിഡ്സ് ഫോർ കമ്മിങ് ആൻഡ് ഹെൽപ്പിംഗ് അസ് ടു മേക്ക് ദിസ് പ്രോഗ്രാം എ ഹ്യൂജ് സക്സസ്. താങ്ക് യു.
Thank you, ma'am. Now it's a blissful moment that symbolizes the enlightenment, unity, and hope, the lightening of lamp. With reverence and gratitude, let us now proceed to the lightening the lamp, symbolizing the beginning of our journey together and the promise of new beginning. For that, I invite Dr. Sheila Nambiar ma'am, Mrs. Debbie Mehtar ma'am, Dr. Radhamani ma'am, Dr. Pradhaban sir, Mrs. P.G. Nair ma'am, and Dr. Priya Nair ma'am onto the stage for the lightening the lamp. Thank you, everyone. It is with immense pleasure and pride I invite Dr. Prathaban Sir, Senior Medical Administrator, Amrita Hospital, Kochi, for the felicitation speech. Welcome, sir.
My pranams to Amma. My pranams to all the dignitaries on and off the dais. Yesterday, I was invited for this function, so I thought that it's only women's club, so gents are not permitted to come. So she did not inform me that I have to speak something. So I was planning to be an audience here. And I heard that there is a lovely women's club or something like that. Few gents are here, so I request we should also have a lovely men's club also. Because they are all Nari Shakti and they are coming forward everywhere. And if you see the medical profession, most of the doctors, nurses, everywhere, predominantly it is by ladies. I always feel that we gents will be an extinct species of doctors and nurses. Anyhow, we are not there. So it's good. They are coming forward in all fields. I won't speak much about that. I wish this function all the best. I have heard our Honorable MP speaking once here. And it's an oration. Such eminent people are here. So it's going to be a very, very energizing for the ladies. I wish this function all the best. May Amma's blessing be with you always. Thank you.
Thank you, sir, for your blessings. With great respect, I heartily invite Dr. Radhamani ma'am, HOD and Clinical Professor, Department of Obstetrics and Gynecology, for the felicitation speech. Welcome, ma'am.
Humble pranam to Amma, sweet. A very fine good morning to one and all. The idea of Pratheeksha is actually years back, actually, Sarida informed me, madam, we need to do something for the women's health. And actually, we planned to start it 1 or 2 years back and identified an area, everything it did, but it didn't work. And then when Priya took in, actually Priya called me to give Janu to conduct the gynec part of the Pratheeksha. I offered her every help. And then actually, Sarida is actually, I always tell, she is my eldest daughter. That much link between me and Sarida is there. Also, Priya is actually again very dear to me. And then about this Pratheeksha, it should start from the adolescent. So there is a great role for the endocrinologist and the gynecologist, because from there onwards, the health issue starts, and so that we need to give about the counseling also is needed for the adolescent, because much of peer pressure, both positive and negatives, are there in the adolescent group. And most of the girls come with, I am PCO as a privilege. No, we should counsel them that again the guidelines are changing, and then only 8 years after the menarche only we diagnose it as PCO. And the worst problem in the reproductive age is, I met, is endometriosis, which is very, very distracting and even marital disharmony. And here the role, actually the gynecologist can play a great role in endometriosis as well as in menopausal group, wherein the woman is not working like me, where the woman is sitting in the home. Actually, the care we must give both the mother, not only the doctors, from the mother family also, we should support the woman. So the counseling part also is very, very important in Pratheeksha. And about we know that there are certain conditions which may predispose to cardiac disease in the late in the life, and also diabetes in the late in the life. So here comes the role of actually the cardiologist as well as endocrinologist. So together we are working, and always my policy is lend a help to all these women, because being a Rotarian, and also I always in the field of lend a help to these people. So congratulate all these people for initiating this. Thank you all.
Thank you so much, ma'am. Next, I would like to invite Mrs. Debbie Mather, ma'am, for addressing the felicitation speech to the audience. Welcome, ma'am.
Very good morning to all of you. The very esteemed Dr. Sheila Nambiar, Dr. Radhamani, Dr. Sarida, Dr. Pradhaban, Dr. Priya, and other doctors and your students. It is with profound sense and pride that I stand before you today to celebrate the inauguration of this Pratheeksha, exclusively a women's clinic by Amrita Institute of Medical Sciences, an institute which has crossed 25 years of service, giving world-class medical treatment, not only now in Kerala, but also elsewhere in the country. And at the beginning, I wish to say that whenever I speak of Amrita Institute, anywhere, be it in Delhi or elsewhere in any of the conversations, people look up to Amrita with great respect and great credential. And I think that's a big, as a Kochi and as also as a member of Amrita family, it makes me happy and proud that Amrita is growing at this stage. Now about Pratheeksha. Pratheeksha, the name itself, whoever has coined it, is so perfect for this women's clinic. Because we all of us rest our life on hope. And there couldn't be a better word than Pratheeksha for a women's clinic. Pratheeksha, as the name symbolizes, is the need of the hour. Like if you look at the women's healthcare as a women parliamentarian who is acutely in touch with women issues, women's health, general women empowerment or women issues, I can say it with precision that Amrita and the team, lovely ladies as you call of Amrita, you have come up with something which is actually the dream of Amma herself. I have no doubt in my mind that Amma considers and her priority is definitely to give good health to women and also a larger goal of women empowerment, women wellness, women care, etc. So this indeed is a step towards achieving Amma's dream as well. So also millions of our hope and our dream that women should get what is due to them. Women face a lot of challenges with regard to their health because of the cultural barriers or with regard to the limitations they face due to the gender inequality, which is still, how much ever we try to say that it's not there, it's still there, we know. But even with all that challenges, it is such steps like Pratheeksha that can bridge the gap and come up with such ideas which can translate, change women's healthcare and life. So as we address women's challenges, each time we read through the newspaper or watch through the news, we see a lot of women committing suicides, even in our state of Kerala. Earlier we used to think all these are for Uttar Pradesh or Bihar or less literate states. But even in Kerala, there are shocking news about women committing suicide. I'm happy that Pratheeksha and this women clinic is also trying to address holistic ways and through counseling how the issues faced by women as well is being taken care of. So Pratheeksha is not, from what I understand, it's not just about routine checkups for women or about giving complex specialized treatment for women, but it also tries to address the other aspects as well. And I'm hopeful that Pratheeksha will also address this factors such as counseling through methods, through outreach, so that the problems faced by women as such are also under this umbrella. And I want to assure my full support and for this Pratheeksha as a woman and as also as a women MP, that I assure my complete support, be it for any outreach program or be it in whatever way I can to support this endeavor of Amrita. And also, looking forward, this is not just a promise, it is definitely, it is not just a milestone, but it is definitely a promise to the millions of women around this region, where they can hope that now there's something very special by Amrita for women, that too coordinated and organized by lovely women of Amrita. So once again, I'm very happy, as always, I'm very happy and delighted to be part of Amrita's, anything related to Amrita, and especially since it is a women-oriented program and a launch of a clinic. I extend my congratulations and best wishes and all my support for Pratheeksha, and let us hope Pratheeksha will give hope to millions of women. Thank you and all the very best.
Thank you so much, ma'am. Now we are going to the much anticipated launching event of our clinics, Pratheeksha, the multi-speciality women's clinic. None of this would have been possible without the dedication and hard work of this team. I would like to take a moment to acknowledge and express our gratitude to all who have contributed tirelessly to bring this possible. For the launching, I invite Mrs. Debbie Mehtar ma'am and Dr. Sheila Nambiar ma'am for the unveiling of our clinics. Welcome, ma'am.
I request Dr. Priya Nair to speak a few words about how we intend to function this clinic.
Om Amriteshwari Namaha. My pranams to all the esteemed members on stage and all my brothers and sisters, teachers and colleagues and students in the audience, as well as the patients that have come to join us today. So just a few words before we move on to the exciting part where we get to hear Sheila Madam's experiences and advice on this very new emerging field of medicine. There has been, for the past 20, 30 years, hospitals all over the country, all over the world, offering women's health packages, comprehensive packages. These comprise of blood tests and ultrasounds and pap smears and echoes and n number of tests that women or anybody at this point are very excited to get these packages done. But health is not merely, as WHO says, the absence of disease, but it's also promotion of wellness. When we look at women's health, there is an aspect that needs to be addressed. The fact that women always consider their own needs and their own health as the last priority. Women are the pillar of a family, and without the women's health, there is ultimately no health in the family, and as a result, there's ultimately no health in society. So our clinic intends not to just be a run-of-the-mill set of tests, be it pap smears, mammograms, screening for breast cancer, etc. But the clinic intends to bring together a series or a group of doctors, medical experts, like you can see in the details of Pratheeksha as we move forward. There are cardiologists, gynecologists, endocrinologists. I'm a gastroenterologist. There's a whole slew of us. But what we would like to address holistically are physical and mental health aspects of day-to-day life, whether it be a woman who might be an ayah at a school or a working executive woman. How can they spend a tailored exercise program for them every day? How does a woman measure their own health on a day-to-day practice? What are small dietary changes that they can make in their lives with existing cultural local foods that can help us move from, a purely carbohydrate-based diet to something that will actually augment our health? So it's not about the high-tech tests, but it's about the small tricks. How can we allay our anxiety? It's thought today that about 50 to 60% of the physical diseases that we all deal with are actually because of psychosomatic factors. And today, most women consider that to be something that's a shameful thing to actually confess. So we want to holistically walk together with the women who come to this clinic, not for tests, but to allay their concerns, to walk them through aspects of day-to-day life, psychological, mental, emotional, physical, and hopefully we can continue this as a monthly visit or 3-monthly visit where we actually, the doctor along with the patient, can go towards wellness. So it's a comprehensive clinic of consultants, dietitian, and exercise specialists, and that's what our clinic aims to do, along with the comprehensive women's packages that have been in Amrita for a very, very long time. So with all of your support and blessings, we all pray that this can start small maybe, but then become a resounding success. So thank you so much.
Thank you, Priya ma'am. As we marvel at the realization of our vision, I would like to invite Dr. Sheila Nambiar ma'am, practicing obstetrician gynecologist, currently the chair of International Relations Task Force of World Lifestyle Medicine Organization. Dr. Nambiar is trained in positive psychology and cognitive behavioral therapy. She runs her own health and wellness program for women called Training for Life, TFL, both in person and online. The program focuses on chronic disease reversal, behavioral change, weight loss, fitness, and lifestyle. She is a published author of 3 best-selling books on fitness and lifestyle. Get Size-Wise, Gain to Lose and Fit After 40, and has been a regular contributor to articles on health and fitness for national and international newspapers like the Hindu, magazines, and online forums. She is passionate about women's health and empowerment, chronic disease prevention, travels, and animals. We proudly invite you, ma'am, for this stage.
Good morning, and thank you so much for inviting me, Sarita, and my esteemed colleagues and friends at the dais. I think this initiative of Pratheeksha as a specialized clinic for women is something that is long, long overdue. And the question arises, is there a necessity for a separate specialty for women? Aren't the diseases the same for both men and women? It so happens that, yes, there is a need. It's not just an arbitrary differentiation, because the way women present with disease, the way they need to be addressed, the way they experience their disease, and the way they experience the symptoms and the management is very different from the way men do it. Traditionally, most research has focused on men and findings are extrapolated to women. But as Dr. Stacey Sims, PhD, says, women are not just small men. We are very different, not just physiologically, not just genetically, because those two are very, very obvious, but there is a acute social and cultural difference, which I think is not addressed in the traditional sense when we deal with other diseases other than obstetrics and gynecology. So this particular clinic, which encompasses all specialties and is focused on women, I think is a wonderful, wonderful idea. Now, according to the ICMR report in this was, I think, in 2017. No, it was in 1997. The incidence of NCDs has increased disproportionately to reach 61% of deaths caused by NCDs. And because India is the most, as we know, 1.4 billion people, poised to become the most populous country by 2050, we know that proportionately the NCDs are going to increase. And some of the common NCDs are your cardiovascular disease, your cancers, metabolic diseases like diabetes, neurological diseases like stroke. And these are some of the common, and there are several others. And all of these have a common root cause, and that is lifestyle. And the most common lifestyle behavioral factors that affect the progression of these diseases is nutrition, exercise, substances of abuse like nicotine and alcohol, sleep, stress, and relationships. And it so happens that there is a new field, it's not new, but it's relatively new, called lifestyle medicine, which was started by the American College of Lifestyle Medicine not so long ago, which encompasses the 6 pillars of lifestyle medicine, which is sleep, stress, relationships, diet, exercise, and substance abuse. These are the 6 main pillars, and there are several minor like environmental aspects of well-being, etc. And the principle behind LM is it's an evidence-based approach to the prevention, the management, and wherever possible, even the reversal of chronic disease. Since we know that the causes of these chronic diseases are based on lifestyle, we cannot ignore the fact that we have to address lifestyle. We cannot just treat patients for their symptoms or just treat the disease. As clinicians based in Western medicine, we're very, very good at treating symptoms. We're very good at dispensing pills, potions, and procedures, but we're not so good at treating the whole person. And this is something that I felt as a gap in my management and my treatment as an OBGYN way back when I started in 1994. And I started with just incorporating exercise into a woman's life. And I felt that I needed to become certified to actually teach exercise because I didn't know who else would. So exercise came into the picture, and then nutrition and psychology and psychiatry is something that I was extremely interested in, which is why I did positive psychology and CBT. And then I discovered that there was an actual field called lifestyle medicine, which encompassed all of these aspects into one. And in fact, it can't be called a specialization. I think it needs to be called a generalization because it applies to every specialty of medicine. What lifestyle medicine enables us to do as physicians is to understand the upstream determinants of disease, which is usually lifestyle. And not just understand them, but also be able to help a woman change her behavior. And as we all know, it's not just our patients. I think we can also say for ourselves that it's very, very difficult to change behavior. Something that you're used to for years and years, something that you are culturally accustomed to and think is normal, is very, very difficult to change. As Priya was talking about the diet and the increased incidence of fatty liver in women, which is not related to alcoholism, so non-alcoholic fatty liver, it's on the rise. So we need to address the reasons for this, and we know it's behavior. We know it's the sedentary living. We know it's the increased incidence of refined and ultra-processed foods, the incidence of refined oils, increased intake of refined oils, and the fact that we've taken the worst of the Indian culture and the Western culture, and we've incorporated it to create this epidemic of non-communicable diseases. Positive psychology and CBT, which are very much a part of lifestyle medicine, I think are extremely important in addressing women's health. Positive psychology is nothing but the scientific study of human flourishing. So what does this mean? This means that earlier than the 60s, psychiatry and psychology focused mainly on psychopathology. So you needed to be ill, you needed to have a mood disorder or a psychopathology like schizophrenia and anxiety, depression, and so on, to actually be treated. But we also know now that absence of disease or absence of symptoms does not necessarily mean the presence of wellness. It doesn't necessarily mean the presence of well-being. You can be not depressed, but it doesn't necessarily mean that you are happy. So we need to be able to increase a person's level of flourishing, increase a person's understanding of their purpose, their meaning, and how to increase their level of life satisfaction using what Dr. Martin Seligman and Peterson, who were the founders of positive psychology, have identified as the 24 strengths of humans. And all of us have a certain kind of distribution of strengths, the top 5 being the ones that we most probably are commonly using in our lives, but we may not even be aware of. So there are strengths, there is the increase in resilience, in grit, in optimism. All of these aspects can be improved in order to increase a person's sense of well-being, not necessarily just absence of physical disease. And it's also been found that even when people have physical diseases, you can still lead a fulfilled life if we increase sense of well-being. So they all go hand in hand. The other aspects that we need to kind of keep in mind regarding women's health and regarding a different approach to women's health is that women deal with, like I said, deal with difficulties and deal with disease, symptoms, treatment, management, etc., very differently from men. And we have what is called as, for instance, the tend and befriend theory by Klein and Taylor. In addition to the fight, flight, and flee response, which we've all commonly know as a response to stress, there is another aspect called tend and befriend, which is what women evolutionarily tend to lean towards. And this means nothing but women tend to gather together when they are stressed, share their problems, and offer each other support. This seems to be something of a survival strategy for women. And yes, it is evolutionary. So we need to understand that that's one of the survival methods for women and be able to support that in our treatment and management. In other words, we need to increase social connectedness for women, and there are many, many ways of doing that, because we know that, for instance, in the pooling project by Chronic et al., published in 2017, we showed that the remission rates and the cure rates, survival rates for cancers, especially breast cancer, was much higher when there was a better social support for the women. That's how important it is. And I think many of you may have heard of the adult study of, Harvard study of adult development, which is the longest standing study. It's in its 8th decade. And what they did was follow up Harvard graduates over 8 decades to understand what is the meaning of a good life, who succeeds, who doesn't, and so on. And what they found, and what Robert Waldinger, the current director of the study, says is that the most surprising factor is that the relationships really matter when it comes to happiness. So we need to keep all these things in mind. How does a woman manage stress? And she manages it very differently from a man does. How does she manage her diet? She is a nutritional gatekeeper, for instance, for the entire family. So influencing her to provide the right kind of diet for both herself as well as the children becomes really important. Does she manage to exercise? A working woman would find it very, very difficult to exercise. How do you incorporate or help her incorporate exercise into her diet? How does she have addictive substances? And I don't necessarily mean only alcohol and nicotine. Food, there is something called food addiction. There is something called addiction to shopping, addiction to the internet. There are several forms of addiction, which are actually behaviors that can take away from our well-being. How do we improve social connections? Because we know that social connections and relationships are at the core of our sense of well-being. So I hope that in this particular organization, Pratheeksha in Amrita, which Dr. Sarita and her team have so ably managed to put together, and I truly commend them for it. I hope we can bring together all these principles of lifestyle medicine, positive psychology, cognitive behavioral therapy, and obviously the medical management as and when it is required. I hope we can bring it all together, and I hope we can succeed in treating the woman as a whole and not just a group of 1 or 2 diseases that need to be cured. And I hope that the younger generation, a whole lot of students sitting here, I hope you're able to incorporate the principles of lifestyle medicine into your own treatment and management. We are trying to bring lifestyle medicine into the medical curriculum and trying to introduce it into as many organizations and institutions as possible, but it's a difficult task. It's slow, but I'm quite sure that we will succeed at some point. And I hope by then organizations like Pratheeksha will also help to establish the credibility, and it is a credible field, there's no question about it. The World Lifestyle Medicine Council and the Lifestyle Medicine Global Alliance have moved the needle for lifestyle medicine to a large extent across the globe, and we just need to accept it as a field that is absolutely mandatory in India as well. So thank you so much, and all the very, very best for the team. I'm so happy to be here, and thank you to every colleagues at the dais. Thank you so much.
Thank you, ma'am. Thank you for your enlightening words. Now it's time for the panel discussion. We have associated a panel of remarkable individuals who are dedicated to advancing the health and well-being of women through holistic approach. Without further ado, allow me to introduce our esteemed panelists. First and foremost, Dr. Sheila Nambiar, ma'am, practicing obstetrician gynecologist, currently the chair of International Relations Task Force of World Lifestyle Medicine Organization. Next, Dr. Sarita Shekhar, clinical associate professor, Department of Adult Cardiology. Then Dr. Nisha Bhavani, clinical professor, Department of Endocrinology. Dr. Janu M.K., clinical assistant professor, Department of Gynecology and Obstetrics. Dr. Lakshmi, clinical assistant professor, Department of Psychiatry. I invite all of them for the panel discussion.
Since we have a relatively small crowd, also among the senior faculty who came, Bindu ma'am from pathology, ma'am, thank you so much for coming this weekend, sparing your time here. So we will keep this as a semi-informal discussion. Whatever we thought as some topics which are important to be discussed, we will discuss here. Then we will have an interactive session. Including students, feel free to ask. അതുകൊണ്ട് ഞാൻ പറഞ്ഞത് ഇത് വളരെ ഫോമൽ ഡിസ്കഷൻ അല്ല. നമുക്ക് ഷീല മാഡത്തിനെ പോലെ ഇത്രയും വലിയൊരു എക്സ്പേർട്ടിനെ നമ്മളുടെ ഒരു ക്രൗഡിന് കിട്ടുന്നത് അത്ര എളുപ്പമല്ല. മാഡത്തിനെ ഞാൻ മാസങ്ങളോളം ഡിസ്റ്റർബ് ചെയ്തിട്ടാണ് മാഡം ഈ ഡേറ്റ് മാറ്റി വെച്ച് നമുക്ക് വേണ്ടി വന്നത്. സോ പേൾസ് ഓഫ് വിസ്ഡം നമുക്ക് മാഡത്തിൻ്റെ നിന്നും ബാക്കി എക്സ്പേർട്സ് ഇവിടെ ഇരിക്കുന്നവരിൽ നിന്നും കിട്ടുന്നത് നമ്മൾ ശ്രദ്ധയോടുകൂടി അല്ലെങ്കിൽ ഈ ടൈം ഈ ഒരു ടോപ്പിക്കിന് വേണ്ടി ഡെഡിക്കേറ്റ് ചെയ്യില്ല. ഇൻക്ലൂഡിങ് ഓൾ ആർ ഇൻചാർജസ് ഫ്രം ദ നഴ്സിംഗ് ഡിപ്പാർട്ട്മെൻറ്റ്. നിങ്ങൾക്കൊക്കെ ഒത്തിരി കോൺട്രിബ്യൂട്ട് ചെയ്യാനുണ്ട്. എന്ത് സംശയം ഉണ്ടെങ്കിലും ചോദിക്കാൻ മടിക്കല്ല. So to start, I think there are few things. We will start with mental health. നേരത്തെ Dr. Prem, Sheila Madam ഒക്കെ പറഞ്ഞ പോലെ health is not just absence of disease. Physical and mental well-being perfect ആണെങ്കിൽ മാത്രമാണ് a person can be said as healthy as per the World Health Organization. So First question I would ask Dr. Lakshmi. Lakshmi, what do you feel is the difference between normal sadness and depression? Ellarkum normal sadness varamallo. So how can we differentiate between a normal sadness and depression?
Namshaya. Actually, we can, all of us have good experiences and bad experiences. So it is normal to feel sad. Actually, if we don't feel sad regarding certain bad experiences, that is also a problem. So that should be within a range. So if it starts affecting our functioning, usually when we are sad, it does not affect our biological functions. For example, your sleep, your appetite, it is not affected in normal sadness usually. In depression and all, the person will have disturbed sleep usually in classical depression, and there are cases where the sleep is increased also. And usually in normal sadness, you will have a good sleep. In the morning, you will feel better, and as the day progresses, you will feel that sadness more and more towards the evening. But in depression, it is usually the reverse. The morning, there is a worsening, and as the day progresses, it will be improved, usually.
Thank you, Lakshmi. Next is about some endocrine disorders. We all know that thyroid disorders are very common in women. So thyroid disorders being quite common in females, what symptoms should alert a person, a female, to test for thyroid disorders? Nisha, ma'am.
Namshaya. I think for the sake of the students, Malayalam or English?
Whichever you're comfortable. I think mixed is also fine, ma'am.
Okay. Thyroid disorders are very common in females compared to males. Previously thyroid function test, doing a thyroid function test used to be difficult in olden times, but now it is very easy to get a thyroid function test done. But then, so it costs only around 250 rupees to get a TSH done. So the best way, and it is so very common in the community, that the best way to detect a thyroid dysfunction as early as possible is to do a TSH once in a while, just like you are checking your blood sugar or your cholesterol. Along with that, you can do a TSH. But specific symptoms which should prompt you to get it done include rapid changes in your weight. Like if you have a weight loss or a weight gain which is not expected from your diet, you should think of a thyroid dysfunction, because thyroid dysfunction, basically it is hypothyroidism which is more common. That is, thyroid hormones korayuna avasthayana more common. That is called hypothyroidism, and increase in the hyperthyroidism is relatively rare. So hypothyroidism, we usually pettanna weight gain cheyum. Dr. Lakshmi Parnavola, we will feel depressed, mood swings will be more, menstrual irregularities we may get, constipation, cold intolerance. All these things may point towards hypothyroidism, but then all these things are very non-specific. And so you feel little out of the way and your common investigations turn out to be normal. It's always better to get a thyroid blood test done. And then one more thing which you should be looking at is your neck. Nowadays, goiters are very common. That is, swelling of the thyroid is very common, and it may harbor, rarely it may harbor a malignancy also. So it's always better, just like we do a breast self-examination regularly, it is better, it is advisable to do a neck examination also once in a while to see if there is any swelling of the thyroid. The bottom line is, anything out of the way you feel, you can get a TSH done and get it diagnosed easily, so that we can diagnose it, treat it early, and become normal. Thank you.
Dr. Janu, can you tell us a little about the decreasing age of menarche?
Good morning, all. I'm so happy to share the stage with such a doyen in the field of lifestyle medicine, Sheila ma'am. Thank you for coming, ma'am. Actually, we are seeing earlier the menarcheal age used to be 12, 13, 14, even 16, 17 and all. Even when the child doesn't attain menarche, even after 18 we started evaluating. But nowadays it has come to 14, the cut-off age, and even 9.5-year-old child or 9-year-old child also attaining menarche. It's a very distressing situation. Since childhood, the food habits all deranged. As most of the children, they eat all the ready, as ma'am said, processed food items and even ultra processed food items, that the awareness has to start from the mothers to decrease the usage of all these items. And we all know so many food items packed in the plastics, other materials. Even one small butter we take, it's the small cube also, it's in the plastic with the gum pasted all around. All these are endocrine disrupting chemicals. Exposure to these kind of endocrine disrupting chemicals at very young age, and even adverse childhood experiences, that and all can lead to, and most of the children, they just eat after, while watching the YouTube videos. So the psychological maturity, they attain very early. So all these lead to the decrease in the age of menarche. So so many gynecological disorders, they encounter when the age of menarche is reduced. Increased incidence of malignancies, endometriosis. It's such a distressing disease. So all this, we can reduce these incidents by improving our diet, and all the children, they have to go out and play. They don't get exposed to the sunlight. They don't play. They should increase the muscle mass. Only when you have more mass, you can lose it at a later stage, after menopause. So they all should build up their muscle mass. The nutrition should be built up at a proper level from the young age. Then only we can reduce the incidence of all gynecological disorders in the reproductive and postmenopausal age group.
Thank you, Dr. Janu. Sheila ma'am, when your talk, you were discussing about food addiction. In this time of so much of urbanization, and as Janu said, so much of processed and ultra-processed food easily available for the mainly in the cities and even now in the smaller places. How do you help your clients or patients to overcome this food addiction, both for the women as well as children?
If there's one thing that I think helps universally with literally everything that is that we are presented with as physicians, it is the aspect of mindfulness. Because when you are mindful about what you're doing, whether it is, as ma'am says, sitting in front of the television and eating something, or having a conversation with somebody else, if you are mindful of the process. And what does mindfulness mean? It just means being in the moment that you are currently in. So for instance, if you're sitting in front of the television and just stuffing your face, you're not being mindful. You're just doing it without even thinking about it. And very often the cues on the television, the advertisements, something comes up about ice cream, and your mind is immediately drawn to that tub of ice cream inside the freezer. That's how ads work. They cue you to think about things that you may not even have thought about. So the whole process of changing behavior, again, the question actually is about changing behavior. The first thing you need to inculcate into people is a level of mindfulness. And there are several ways of doing this, starting with simple practices like mindfulness meditation and so on. But you don't necessarily have to go through a formal mindfulness practice. For you, although that helps, even 5 minutes of mindfulness practice morning and night seems to permeate into the rest of the day, but you don't necessarily have to have it as a formal practice. I think mindfulness is about being in the moment on a day-to-day basis, being conscious of your signals that the body is sending you. Like your body will tell you that you're full. Your body will tell you that you are hungry. Your body will tell you you're uncomfortable, but most often we don't listen to it. So this question of addiction, food addiction, comes because we're not listening to our bodies. And this starts from a very, very young age where, for instance, if you notice children being fed, it's the adult who serves the food. And even when the child says enough, the rule is finish what's on your plate. And in all likelihood, it's some terrible choices that are on the plate. So you are feeding your child. The child has no choice in the matter. It doesn't know what it is to actually be full and respond to the body's signals, which means as the child grows, it starts to suppress its own body signals in every which way, whether it's hunger and satiety, or it is a level of sadness, depression, anxiety. These emotions are suppressed. And as ma'am will tell you, if you suppress one emotion, it comes out in a different way, right? There are different ways in which we project our suppressed emotions. So when coming back to the question, when you talk about food addiction or any other form of addiction, you start with the mindfulness. You start with the fact that you know what you're doing, you understand what you're doing, you accept what you're doing without judgment, and then you take steps forward by introducing small, manageable changes that are helped with people in the lifestyle medicine field, the psychologist, the health coach, who will handhold. It's very difficult to do this on your own, so there has to be some amount of hand-holding that goes on. Inspiration, motivation from the person who's actually guiding you, which I think is what this particular multi-specialty clinic should have. A health coach, absolutely mandatory. A psychologist, absolutely mandatory. So the person comes back and talks about the difficulties she faces trying to change this behavior. I want to stop, eating mindlessly, or I want to stop smoking or drinking, whatever it is. They come back on a regular basis and talk about the problems that they have. And then you form groups, which again is talked about in lifestyle medicine, the shared medical appointments, or SMAs, which help with discussing, like I said, the tend and befriend theory, especially for women, when you talk about it with other women and realize that, oh, she's facing the similar problem. So it helps to put your hand on somebody else's shoulder and tell them that I'm here to support you and in your journey, and there's no judgment here, but I'm here to support you in your journey. So it's a combination of many things, but I think what's required is an able, kind, compassionate facilitator to help them through this.
Thank you, ma'am. Dr. Lakshmi, do we have Dr. Dhanya around? Dr. Dhanya Chandran? I'm sorry, no, she's not there. Lakshmi, what do you feel are the most vulnerable periods in the life cycle of a female that can make them prone to develop a psychiatric illness?
Ma'am, anybody can have a psychiatric illness any time during their lifetime. But especially when a female is concerned, there are periods in their life cycle where the person is vulnerable to develop a psychiatric illness. For example, menarche, the menstrual cycles when it's going on, the menstrual periods, then the peripartum period when you're pregnant, the lactation period, and also the menopausal stage. Especially due to the hormonal changes which are normally happening in the body, that makes the person vulnerable to develop a psychiatric illness. Especially on top of it, there are so many environmental factors which will contribute to the development of an illness. So these are certain areas where we can expect that new psychiatric illness will develop, or the worsening of a already existing problem.
This is where I think all of us should stress upon, like how frequent have we taught our daughters about facing menarche or their mood swings during the menstrual cycle. Most of the time there might be an exam the next day and they'll say that they're not in a mood to read. Immediate response from a mother, including me, is like, you're trying to make excuses not to study. This is just a normal phenomenon. All of us have gone through it. What is a big deal? The same applies to us when we are going through menopause. Our mothers went through, our grandmothers went through, but then we are all lucky to at least be able to share our problems because we are working and we come out of the house every day. Think about the women who are not independent and cannot take support. So I think those, and also postpartum. So these vulnerable time, how much of support our family members, our friends need should always be kept in mind. Nisha ma'am, how do you feel is diabetes different in females compared to males?
So diabetes is very different in females when compared to males. starting from the risk factors for diabetes. So females have got more risk factors for diabetes. For example, females have PCOS, they are at high risk of developing diabetes in the future. They develop GDM, they are at very high risk of developing diabetes in the future. So the risk factors for developing is in females is more. Overall number of males with diabetes are more than number of females, but then the number of people with impaired pre-diabetes is more in females when compared to males. So they are more prone to develop diabetes, but once they develop diabetes, they have more of comorbidities also. For example, females with diabetes have more of hypertension, they have more of obesity when compared to males. And they have more risk of complication, especially cardiovascular disease. They are at very high risk of cardiovascular disease and all other complications like renal failure, neuropathy. Everything is more common in females when compared to males. This may be because of the fact that they don't care about themselves. Generally, females tend to ignore their health. They seek medical attention late. They tend to ignore their health for the sake of the family. So I think that is where we should improve. Females are the, ladies are the pillars of strength for the whole family. If they collapse, the whole family is going to collapse. So they should take care of their health more importantly than the other members of the family, I would say. So that point should go across to the society. The amount of diabetic distress, that is the distress which long-standing diabetes will have more of distress, psychosocial stress. All these elements are much more common in females, which place them at increased risk of developing all these complications of diabetes. So the primary thing is, as it boils down to what Madam is telling, it is a lifestyle which has to change. You become diabetic, there is a what is called generational effect for that. Your children are more prone to develop diabetes, they are more prone to develop GDM, and their children are more prone. So it goes on and on and on in the society. So maintaining an ideal, maintaining a healthy lifestyle of a female is the most important thing which you need to maintain a healthy society, I would say.
In continuation to what Nisha Madam was telling, it is very important that we all understand the most common cause of death among women is heart disease. Cardiovascular disease, which includes heart attack and stroke, are the most common cause of death among women, just like men. The absolute numbers, as said earlier, might be more in men, but then in women also it's a very high risk. Also, we should remember that women who had bad obstetric history, like gestational diabetes, hypertensive disorders during pregnancy, preeclampsia, repeated abortions, all these women are prone for future heart disease. So most of the time after the delivery, these values normalize for a few years, and that's when they're busy with their bringing up the kids and all that, and they never come back for checkup. Then we see them late with a full-blown established non-communicable diseases and cardiovascular disease. Women present late with heart disease as well because of the atypical presentations and non-specific symptoms and the ignorance and reluctance to come forward for regular checkup. Women present late, and most of the time the outcome of women following a cardiovascular event is also worse compared to men. Poor medication compliance, the reluctance to come back for routine checkups, all these are more among women, and it is more in countries like India. So going to the next question, Dr. Janu. How do you think we can help women overcome through the period of menopause? How can we help them, or what sort of exercise can we advise?
Exercise, when we say, most of us think only about cardio exercise, like simple walking. But I feel we have to do the strength training also, that improving the quality of the muscle and as well as muscle mass, that's more important. More than the mass, quality is important. So apart from routine walking, even simple water bottle with 1 liter water bottle, not necessarily everybody should buy 1 kg, 2 kg weights. You can use simple water bottle. Earlier when we think, we ummi, all that. So in our olden age times, all our mothers used to do this, no mixie, no grinder. Even for men, all these are kind of strength training for them. But now we simply use mixie, grinder for each and everything. So we include strength training also as a part of our routine lifestyle, apart from cardio exercises. After menopause, after 65, 70, muscle mass starts declining. So that leads to gait issues, functional disability. So by doing strength training routinely, we can improve all these aspects. Now more incidents of Parkinsonism, even simple functional disorders, movement disorders are there. So we can, if we do include all these exercises, gait, certain exercises to improve the gait and stability, all this will help lot in postmenopausal age group.
Sheila ma'am, among your clients, how exactly do you monitor whether they are compliant to the dietary advice which has been given and also the exercise program? Like how do you make sure that they're continuing what has been advised, or do they stay and take a training session, or is it online? How do you do it, ma'am?
Yeah, I do. I have various ways in which I do it. I have group sessions. I still teach online classes. Over COVID, it became online, but since the year 2000, I've been teaching group classes for women, and one of the reasons I do that is then I get my exercise in. So there's a selfish motive. It's become online. So we do have a group exercise session. But when they're individual clients, one of the things that I do is to get them to take photographs of their food from morning to night and send it to me, send it to my assistant. I have people who will look at the food, visually be able to assess how many servings of each food group there is, and ask them to slightly modify the amount that they consume first, because and a positive prescription is always better than a negative one. So for instance, advising a patient who has this huge pile of rice and with very little vegetable and maybe a little bit of dal, just telling her to switch that around and start with eating the vegetables first, preferably not full of oil and seasoned and killed, but to eat a fresh large salad and then add a little bit of rice as a side dish, and then consume enough of protein, and it doesn't have to be animal protein, it can be plant protein as well. So a visual representation always helps. The other way is, of course, to write the food journal, where they are made to write down exactly what they're eating with the quantities in the measuring cups that we all use for baking, etc. So 1 cup of rice, half a cup of whatever it is. So that by the end of the day, they also have an assessment of what they've eaten. Because human beings are tremendously capable of forgetting what we ate. We walk past and eat a bar of chocolate and just forget about it. So if you write it down, then it makes that much of difference when at the end of the day or at the end of the week you can assess, okay, what have I done better? And as far as exercise goes, if people are not able to attend, for instance, and I just do online consults with them, and I have programs, 12-week programs, 8-week programs. During the course of the week, they manage on their own. So if I give them an exercise prescription, which I do, depending on the level of fitness of the particular individual, then we assess by the end of the week, what are they able to do? So yes, while you can start with water bottles for strength training, I would expect you to improve. You can't spend the rest of your life lifting water bottles, right? You need to be able to increase in muscle mass and strength, which actually requires some amount of effort. And the key, I think, is for us to start, us as doctors. Unless we do that, and unless we actually experience what it's like to be in zone 2 cardio or zone 3 cardio, to do a high intensity interval training, or to increase the weight that you use when you lift, you're not going to be able to recommend it to your patients. You don't necessarily have to do a strength training session with them, or you don't necessarily have to prescribe strength training. But we know from research that it is the doctors, nurses, whoever is counseling the patient, it is those who actually implement it into their own lives that are able to be more authentic and inspirational for the patients. Otherwise, the lack of authenticity comes through, and the patient tends not to pay too much of attention. Nowadays, when I started and I was I'm talking about 30 years, 25 years ago, and when I was talking, I would talk about exercise and I would talk about diet, and I was always having run-ins with the family of the patient. Even if the patient wants to listen, the mother, the grandmother would say, oh, how can you tell her to eat less rice and more of this? The baby will have gas. For instance, postnatally, there was this misconception that if the mother eats beans and dal, the baby will have gas, things like that. So we would always, have these discussions. Now I have patients come to me with a symptom, let's say of DUB or, whatever have you. And then when I have 10 minutes with a patient, 10, 15 minutes with a gynec patient. Before I finish, they will say, ma'am, aren't you going to tell us about diet? Aren't you going to explain to us with your cups? And I would be like, how did you know? And they'd say, oh, my sister came to me and then she said you showed them cups and told them how much to eat. So people are understanding. People are actually getting to figure out that their diet is important. And you'll find the most simple village women, and most of my patient population is rural and semi-rural. They are really interested. How do I manage my stress? My husband's really annoying and I get really stressed. I know I shouldn't be. Or my mother-in-law is troubling me too much. I know I shouldn't be. What do I do? So I think it's on us to actually increase this awareness and then apply it to ourselves first. Then we are able to propagate.
Also, ma'am, how long do you monitor them this closely? Like, what is the duration of follow-up you give?
So the online classes are ongoing. You just sign up every month. So my programs are 8 weeks, 12 weeks, etc. But I always recommend they come back to do reviews once a month for at least a year. At least, that's a minimum. Because we know that the maintenance phase in the stages of change is actually 5 years. So, which means any time in the maintenance phase, you can slip back to one of the previous stages of contemplation, pre-contemplation, what have you. So at least for a year, you need to have some form of accountability to the person that you're. So in your clinic, for instance, you should have a program where the women are allowed to come back maybe once in a month for group sessions, and then maybe if they're not able to come once in a month, once in 3 months, or once in 6 months, at least for a year. And then thereafter, it could be optional where they could do it online or they could do it, if they can come. There's nothing like in person, obviously, but I would say at least for a year.
You have support groups or WhatsApp
Yes.
groups of
Yes,
batches?
I do. Yeah, I do.
Thank you, ma'am. Lakshmi, when do you think that a woman should consult a mental professional, take professional help for that reason?
When the distress they are suffering becomes overwhelming, it starts to affect their functioning. If it affects the social functioning, if it affects the occupational functioning, that we can't interact with others, we can't do our job, or we are resorting to substance use to deal with those stress, that time, especially when you have suicidal thoughts and all, you have to consult a mental health professional. No harm in consulting when you have a distress, but then if these red signals are there, red warning signs are there, definitely it's high time that you meet a
I think the
mental health
most important point is that we should, not only we should encourage all women to speak out their problems, discuss it with their peers or family members or friend or to whomever they can confide it to. That is most important. When it is kept within the mind and it multiplies and beyond a point goes out of control, which should not wait. We should encourage our patients also to do the same. Nisha ma'am, can you tell us a little about how women should follow up for postmenopausal osteoporosis?
Postmenopausal osteoporosis is a silent killer. So all of us build bones during our young age. But then after menopause, we start losing bone. So the bone density decreases. And after cardiovascular disease and cancer, hip fracture and the subsequent bedridden state will lead to death in a substantial number of females. So evaluating postmenopausal osteoporosis is very important, and prevention is also equally important. How do you prevent? You take, as already discussed, a good lifestyle, like healthy diet and exercise, a diet rich in calcium, adequate exposure to sunlight to get adequate vitamin D, strength training, like a good muscle mass will maintain a good bone mass, and those lifestyles are very important for prevention and avoiding substance abuse like smoking and alcoholism. All these will contribute to a good bone health. But but the hormonal changes is something non-modifiable. So you all lose your estrogen after your menopause, and estrogens are the major hormones which are maintain your bones healthy. So once you lose your estrogen, you start losing bones, and only if you measure your bone density, you will know whether it is low or normal. So it is recommended that all postmenopausal women above the age of 60 or 65 should get a bone scan done using a DEXA machine. The DEXA is the machine which measures your bone mineral density. So everyone above the age of 60 or 65 should get a bone mineral density done. And based on the baseline values, you can follow up. If it is normal, you can follow up once every 3 to 5 years, or if it is low, you can follow up after a year. And if there is osteoporosis in DEXA, there are good treatments which are available which can prevent a fracture, because osteoporosis is asymptomatic. You have an osteoporotic bone, you don't have any symptoms. Only the fracture will be the first symptom of an osteoporosis. And you develop a hip fracture or a vertebral fracture, that is a terminal event in a substantial number of people. So you maintain your bone health adequately, get your bone density done once you are old, and maintain a healthy lifestyle. That is all important for maintaining a good bone health.
One last question in which I think Nisha ma'am and Sheila ma'am, please give your inputs. What is your opinion regarding sugar in diet? Also the use of artificial sweeteners. Is it that we should completely avoid sugar in diet since childhood? Is that the right way? Take natural carbohydrates or the sweetness which is available in the natural food items? Or is it okay to give sugar to the children and the young adults, or till they are, if they are not diagnosed with diabetes, continue to use it?
So usage of sugar depends on whether you are a diabetic or not. So in the context of a non-diabetic patient, the sugar, it's actually the calorie content of the sugar, and if you eat a equal quantity of sugar and an equivalent calorie of something else, of a protein, of some other food like a rice or bread or something, it is okay. So it basically depends on the calorie content for a non-diabetic. For a diabetic patient, you eat a simple sugar, you add a table sugar, your blood glucose is going to go up, because it is a high glycemic index food. So it is going to worsen your diabetes. That is why we ask to avoid simple sugars in diabetes. But in the context of non-diabetic, it is as good as any other equivalent calories. Something else.
Artificial sweetness.
Artificial sweetness. So artificial sweetness, WHO has last year issued a recommendation to limit the intake of artificial sweetness. But according to the American Diabetic Association, all the artificial sweeteners which are available in the market, they have a recommended daily allowance, how much of each you can take. So if you can follow that, the long-term risks are not that high. So if you follow the RDA, you should be knowing what you are taking. So for example, Equal is one artificial sweetener, Splendid is another artificial sweetener. There are so many things which are available in the market. So you should know what you are eating, and you should know the recommended daily allowance. That is okay according to literature. But for an ordinary patient who comes to me, I would tell them, you can take it once in a while when you are very keen to take artificial sweetener, but replacing it for sugar is not the ideal way to do it. So once in a while, if you feel like having a sweet like tea with sugar, or you have some artificial sweeteners, they will tolerate temperature. Like you use it while cooking. Some you can't use it while cooking. So there are a lot of specifications which you need to know. Which is the chemical component, which all you can use for cooking, which all you can use it as plain. So if you can follow all those things, once in a while taking it is okay, but it should not be a replacement for sugars.
What is your
About
advice?
Sugar? It's quite a controversial topic, isn't it, sugar? In my opinion, I think we require zero sugar in our diet. Zero. because it's a non-nutritive substance. It provides absolutely zero nutrition. And there is the aspect of the addictive quality of the sugar. We know that sugar produces a certain level of addiction which causes us to crave a little more of it, whether you're diabetic or not. And like ma'am says, of course, it produces the spikes in insulin, the spikes in sugars for a person who's already diabetic. But why are we waiting to become diabetic? India is the diabetic capital of the world. All of us are going to be diabetic at one point or the other, the way it's going. So why are we waiting to become diabetic? If you stop adding sugar, and I'm not just talking about the table sugar that you put into your tea and coffee. If you noticed, every packaged food has added sugar. Everything has added sugar to enhance flavors. So if you are again mindful of what you're eating, that means you're paying attention to the labels, you're paying attention to what you put in your mouth or what you add, and you start eliminating the things that are causing you to behave mindlessly. Okay, like take a packet of Pringles chips. The ad itself says you can't stop with just one. That's the psychology behind advertising, because they know that once you get that addictive substance into you, which is a combination of starch, salt, and fat, it's very difficult to stop. So if you are conscious and mindful of the fact that this is what's going into your body and it's causing me a bit of addiction and I'm eating a hell of a lot of it, you're still mindful of it, the chances are you won't keep repeating it. But if you do it without even thinking, and you think it's okay and you're justifying it, which most of us do, where our behaviors are always justified to ourselves, it just becomes that much easier as we grow older. Because when you're younger, your body is able to handle the extra food, the extra sugar, the extra whatever little bit. A body is able to handle it. But believe me, when you grow older, you got to do twice as much just to stay where you are, literally. I know what it's like to exercise now as it was 20, 30 years ago. It does take its toll. However much you take care, the stress, the sleeplessness, and as an OBGYN, that's the biggest thing. You don't sleep, and the sleepless nights causes you so much health, it takes so much from your health that you need to be aware of the fact that this is what it's doing to you. So as long as you are consuming your sugar, let's say you have a birthday party and you have to have a slice of cake, as long as you are mindful of the fact that I am going to have this piece of cake and it's fine, I'm going to enjoy it, not beat yourself up about it, but I'm going to enjoy it while it lasts, and it's my child's birthday or whatever it is, it's fine. But if you're going to do it on a regular basis and tell yourself it's okay, then you need to ask yourself, is it really okay? Because I know that when I switched from taking, I love the South Indian, the coffee that we get in Tamil Nadu, the South Indian coffee, it's delicious, it's milky, it's sweet, and it's very, very caffeine rich. And I remember in college that used to be a real treat, and when I went off milk and milk products because I was not comfortable with it, and stopped sugar altogether, now I cannot consume coffee with milk and sugar, and it's not because I'm stopping myself, but because my body is accommodated to the new thing. And it's not just sugar and the spikes, it's also about your gut microbiome, and it's also about what these things do to the brain. So we need to be aware, like I said, that we are an integrated body. We are not just separate. The gut is not separate from the liver, separate from the brain, separate from our genital organs, and it's not. Everything is one. So what you do, your behavior influences everything, including the way you show up on a day-to-day basis, including your energy levels. It affects everything. So I think we need to be mindful of that.
Thank you, ma'am. And before we open the discussion with the audience, Dr. Priya, can you tell us something about NASH in women? Is it different from men, or is the presentation different?
Thank you for the question, ma'am. I think I was talking to Sheila, ma'am, also about this before, there, I think when we talk about metabolic syndrome and physical diseases in women, nobody will say liver first. They will automatically say, okay, cardiac diseases, gynecological diseases, maybe even psychological, but nobody will talk about the liver. Because there's a huge misconception that liver disease is purely because of either alcohol, which in India at least, women are not that known to be alcoholics, and then you have sexually transmitted diseases, which again, that doesn't come to mind. But that's over the past 10 years, probably even less, there's a huge shift. At least every day we diagnose 2 or 3 women in our own personal practices here at Amrita. We diagnose women with cirrhosis of liver, and not a single one of them is an alcoholic, not a single one has any kind of hepatitis B or C. So we are finding, and we are actually on the brink of publishing a paper on that, NASH, or now what has been renamed as metabolic disease associated liver disease, MASLD, that presents much faster in women than it does in men. So let's say that it takes 10, 15 years for you to move from the progression of fatty liver through fatty hepatitis, through fibrosis to cirrhosis. If that takes 15 years for a male, it potentially happens so much faster in women. And again, this is everybody will say, we'll study the genomics, the genetics, whatever, but the fact still remains that till today, non-alcoholic fatty liver disease, or now what is called MASLD, is almost purely lifestyle related. And lifestyle for women in India is always more sedentary than men. So it's really frightening, and that's something that is also especially frightening because nobody has an awareness of that. You think of a disease like diabetes, you immediately think of kidney failure because everyone's afraid of the dialysis. You immediately think of heart attack, stroke, maybe all kinds of peripheral vascular diseases. But who actually thinks of the liver? Nobody. And now, a lot of research, and maybe I am biased because I'm a gastroenterologist, but they are actually postulating that it might very well be, liver being the largest metabolic organ in the body, that it may very well be that fatty liver precedes the onset of even what we traditionally call metabolic syndrome. Because liver is the storehouse for fats, it is the powerhouse of circulation of cholesterol in our entire body, it deals with most of our hormonal metabolism as well. So the importance of recognizing that liver also needs to be screened in people other than alcoholics and men on IV drugs and potentially people with hepatitis, I think that is something that I was initially surprised to see in our own comprehensive health clinic. They used to not do the LFT, they used to only do SGOT-PT. Even our so-called ultrasound evaluation of fatty liver is extremely poor. And this is something that is still evolving, very poorly recognized amongst our own community, forget the public at large. So yeah, this is something that I hope we can increase awareness in society.
I think that concludes a few topics which I thought would be important to discuss. Radhamani ma'am, anything to add?
Regarding the adolescents, actually, as Janu said, awareness to mothers is very important about the food item. So even if more financial background is there, the girls are very specific to the food. They eat only the food which they like, not will take all the nutrient foods. That is most important. We are actually നമുക്ക് എന്താ പറയുക അനുഭവിച്ചുകൊണ്ടിരിക്കുന്ന ഒരു കാര്യമാണ്. And so we have to go to the schools, and also school health program is very important in about the most importantly the peer pressure, their attitude towards what all things we say, they may not accept everything. That is the most important thing. Whether it is a good or bad, they don't know. So we need to have another very important thing is we should have a very, very friendship and very close to our students so that they will disclose everything to us rather than going to a bad habit or on, so that gaps with the parents, especially the mother and the child, is even with boys also, is very important. Another thing is in the reproductive age group, it is a continuation actually. In PCOD patients coming with irregular cycles and all, so we have to again, the awareness to the year, with between 9 and 11 to or 12 to 13 years is the age, we need more attention to the girls not to become obese. അവിടെയാണ് നമ്മൾ തുടങ്ങേണ്ടത്. Another thing is in the menopausal age group wherein we know that there is estrogen deficiency and all the symptoms, especially prolapse, so many, even stress incontinence, and so the power of the, even the knee joint, even it starts from the age of 40-45 years. So the muscle strengthening, as Janu said, is very important, and also including the holistic medicine is very important for muscle strengthening. അതാണ് നമ്മളുടെ, as you said, നമ്മൾ വീട്ടിൽ പണ്ടൊക്കെ നമ്മൾ അരയ്ക്കുമായിരുന്നു, അരിയാട്ടുമായിരുന്നു, ഇടിക്കുമായിരുന്നു. So these are all muscle strengthening, these are all gone. അപ്പോൾ അത് ആക്ച്വലി ഇൻസ്റ്റെഡ് വി ക്യാൻ അറ്റൻഡ് ദ ഹോളിസ്റ്റിക് മെഡിസിൻ ഡിപ്പാർട്ട്മെൻറ്റ് ഫോർ ദി എന്താ പറയുക മസാജിങ് എക്സസൈസ് വെരി യൂസ്ഫുൾ ഫോർ സ്ട്രെങ്തനിങ് ദ മസിൽ. അതുകൊണ്ട് തന്നെ വി ക്യാൻ പ്രിവെൻറ്റ് നീ ജോയിൻറ്റ്, the joint pain and also the joint problems, and most importantly the urinary problems also. The muscle strengthening is very, very important for the pelvic muscles. And then again after the age of menopause, the support to the family is very important because they are also like children. Such small things also may traumatize them. That also the generation of you has to be more important in taking the care of their seniors or the elders in the family.
Thank you, ma'am. I think the message the last 1 hour we were discussing is for the younger generation. Always remember that God's grace, the senior most faculty here, they were in an era where nothing but home cooked food was available. So my generation I would call maybe hybrid. In our childhood, I don't think we ever ate any junk food. We only had what was cooked at home by mother or grandmother. But for you, it's not like that, children. It's easily available and you're all very young. And please understand that though it is very tasty, മലയാള സിനിമയിൽ കോമഡിയിലൊക്കെ പറയുന്നത് the taste is only till the neck. അത് ഇറക്കി കഴിയുമ്പോൾ പിന്നെ ബാക്കി എല്ലാം is going to harm the body. So ഷീല മാഡം പറഞ്ഞ one particular phrase, that mindful eating, നമ്മൾ എന്താണ് കഴിക്കുന്നത് എന്നുള്ളത് അണ്ടർസ്റ്റാൻഡ് ചെയ്ത്, ഐ നോ ഇൻ നഴ്സിംഗ് കോളേജ് യു ഗോട്ട് എ വണ്ടർഫുൾ ടീച്ചിങ് സ്കെഡ്യൂൾ ഓഫ് ഡയറ്റ് ആൻഡ് ന്യൂട്രീഷൻ. ഐ എം അവെയർ ഓഫ് ഇറ്റ്. അപ്പം ഇത്രയും നിങ്ങൾക്ക് അവയർനെസ് ഉണ്ട്, അത് എത്ര നിങ്ങൾ ഇംപ്ലിമെൻറ്റ് ചെയ്യുന്നുണ്ട്, ആൻഡ് ഹൗ മച്ച് യു ക്യാരി ഇറ്റ് ഫോർവേഡ് ടു ദ സൊസൈറ്റി. യു ക്യാൻ ക്രിയേറ്റ് ഇൻഫ്ലുവൻസ് അമംഗ് യുവർ ഫ്രണ്ട്സ്, പിയേഴ്സ്. ഒരാളൊരു ചേഞ്ച് വരുത്തിക്കഴിഞ്ഞാൽ ഗ്രാജുവലി ചുറ്റുമുള്ളവർ ആ ഒരു ചേഞ്ചിലോട്ട് അഡ്ഹിയർ ചെയ്യും. But that is one thing which we all should remember, because we don't know why so much of non-communicable diseases, including cancers, are on the rise, despite the fact that social media, health talks, availability of doctors. India is a country where we can walk into any specialist room at any time of the day without any hesitance. Matte countries langanalla, if you have to get an opinion from a specialist, we have to wait months together. അപ്പോൾ ഇത്രയൊക്കെ ഹെൽത്ത് ഫെസിലിറ്റീസ് ഉണ്ടായിട്ടും നോൺ കമ്മ്യൂണിക്കബിൾ ഡിസീസസ് ഇൻക്ലൂഡിങ് ഹാർട്ട് ഡിസീസ്, ഡയബറ്റിസ്, ഹൈപ്പർ ടെൻഷൻ, ഒബീസിറ്റി, മെറ്റബോളിക് സിൻഡ്രോം, cancers, everything is on the rise. അപ്പോൾ ഇറ്റ് ഇസ് ടൈം ഫോർ us to introspect why it is. So that lifestyle എന്ന് പറയുന്നത് നമ്മളുടെ സംഭാഷണത്തിൽ മാത്രമല്ല, how can we implement it is a big food for thought from what we discussed today. Thank you so much all the experts in the panel. Yeah, ma'am. Yes, ma'am.
Increase in rise of carcinoma breast in the youngsters. Even at the age of 20, 22 and 25 we are seeing. Even carcinoma endometrium also, even at the age of 25, 29, we have a patient at 29 years. We can't imagine a 29-year-old woman after IVF treatment, she is coming with the carcinoma endometrium. So another thing, carcinoma of the breast is very increasingly, we can't imagine, very young girls are coming with the carcinoma of breast, and that's very traumatic it is. Another most important, we should encourage HPV vaccine that I forgot to tell you. HPV vaccine, it is a very important in the, so we had to start from the age of 9 to 14, only 2 doses, and from the 15 to 26 age group, 3 doses. We are having all the materials with us because we can approach the students of all the different groups and then encourage Priya, we have to encourage that to buy this. Actually, Serum Institute is able to provide. So the MRP is the problem, so that we need to encourage them because നമുക്ക് കുട്ടികളുണ്ട് actually MBBS കുട്ടികളുണ്ട്. All the different groups of students are here, so we need to give HPV vaccine to them. And if possible also the rubella vaccine before pregnancy. And they've got the postpartum blues and the postpartum depression. Usually the postpartum blues is quite common after it lasts only for 2 weeks. But there are situations where unexpectedly when the newborn goes to the ICU, unexpectedly, if there is a disease, okay, if we are preterm, we know that the baby will go. Unexpectedly, if it goes, actually it is very traumatic to the mother. And the support of the family is very, very important. And if it lasts for more than 2 weeks, definitely she needs treatment about the psychiatry, postpartum depression treatment. Otherwise, postpartum blues may not need a treatment, it only support.
Is there any other questions, any other doubts? Please feel free to ask. ഞാൻ നേരത്തെ പറഞ്ഞു, consider it as a semi-formal discussion. Anything which has come to your mind?
I wanted to pose a question to Sheila ma'am because we didn't have that discussion, but sleep hygiene. There is a little bit more awareness coming up on diet and exercise, but the importance of sleep, especially since now almost all our homes have a TV in the bedroom and you don't need a TV anymore for anything. It's just YouTube. Every single person, all the youth, we see about 10 to 15 dyspepsia patients at least a day in our individual clinics. And every time you talk to them about food, you ask them, do they have their 2.5 hour gap between food and laying down? They all have it because they may eat at 9, but they're watching YouTube till 2 a.m. and the light is off, there's no stimulation externally, but they're on YouTube. So the importance of sleep hygiene on everything from obesity to hypertension to psychological issues to fatigue and psychosomatic problems, what ma'am do you say about that, and how do you advise people in the clinic when they come with actual physical issues?
Thank you for the question. It's really, really important. None of us really think about sleep as being so critical. And as an OBGYN, I can tell you that not having enough sleep, you don't realize how bad it is till you stop having the problem. When you're in it, you don't realize that you are sleep deprived, that your moods are different. You really don't get it till you actually get out of it. And you're right that the sleep hygiene practices are not really implemented on a regular basis. And to put it simply, a good night's sleep starts from the time you wake up. Because when you expose yourself to sunlight, I'm not talking about looking directly at the sun, but exposing yourself to light into your eyes, into your retina for at least 10 to 15 minutes within an hour of waking up. So you could just sit on your balcony and drink your cup of coffee. That sets the circadian rhythm for sleep. And we know that the circadian rhythm is present in every single cell of our body. Anybody who's interested in sleep and sleep science can read or watch the work of Dr. Sachin Panda, who talks about circadian rhythm and sleep and the importance of it in weight loss, importance of it in diseases, and so on and so forth. So you start with your morning ritual, the fact that you can get out, sit for 10 minutes or do yoga in the balcony, whatever it is. And your food, like you said, at least 2 hours before your proposed sleep time, not before you actually sleep, before your proposed sleep time. So if you plan to sleep by 10 o'clock, at least finish your last mouthful before 8 o'clock, 8 p.m. And plan to sleep for at least, we know that 7 to 8 hours is what is advised and what is adequate, and it is 7 to 8 hours of uninterrupted sleep, not the nap in the afternoon and 3 hours at night. It's about 7 to 8 hours of uninterrupted sleep, preferably when it is dark outside. Because we know that, again, shift workers who sleep in the day and work in the night, the Nurses' Health Study and all these studies have shown the increased incidence of metabolic diseases for such women, and obesity, depression, all of these things are increased because the fact that we have to sleep when it's dark outside. Think about it. Evolutionarily, we never had light. So you had to go to sleep once the fires were put out and once we finished eating. It's only now that we have artificial lighting 24/7, and which is not helping us sleep well. At the same time, it's stimulating the systems and the processes in our brain which keep it alert, but at the same time not fully alert. So even if you think you're doing a good job with your presentation that you're working on, you know, till midnight and past midnight, you're not really doing such a good job. You're better off getting your sleep and then starting to work on it, for instance, the next morning or the next day. So the first step, I think, is to impose, or rather influence the patients and yourself about the importance of sleep. I think most of us don't really register that importance of sleep because our medical curriculum itself does not enable good sleep. We are made to work 12 hours, 24 hours, 48 hours without sleep. So then it kind of normalized that, you know, you don't need to do it. And then, of course, now added to all this YouTube and the various gizmos and the blue light coming from the screens is not good for us. It's not good for deep sleep. So first establishing the importance of good sleep, the importance of good sleep at the right time when it's dark outside is extremely important. And then getting light into your eyes first thing in the morning, eating before, within a gap of about 2 to 3 hours before your sleep, all these are important factors. Also not exercising too hard close to your sleep time, because that again energizes you too much, and you know, you're not able to get a good night's sleep. All these things have to actually be kept in mind, right? And the first thing I think is establishing that the sleep is very, very important. Most people don't realize that.
Are there any more questions from the audience? In the case, I thank all the experts. Sheila ma'am, thank you so much for your valuable comments. I think, Gayatri, you can announce the next session.
As we wrap up, let's carry the spirit of this discussion forward, continuing to explore, learn, and grow. Once again, thank you so much, everyone who have participated in this discussion. And thank you so much. Thank you from the bottom of my heart. Next, we are moving to a special exercise training session, leading by Dr. Amrita Vishwanath and team from the Department of Physical Medicine and Rehabilitation, School of Medicine, Kochi. Welcome you all to this stage.
Good afternoon, everyone. So we are talking about women's health. Why health of a woman is different from that of a male? Because the female body is different from male body, and also the hormones that are acting. And women has to pass through all different stages of life, including menstruation, pregnancy, childbirth, menopause. So all these factors, there is a difference in health of a woman when compared to males. So if we are, and also if we are talking about health of a woman, we will have to approach in a holistic way. So the mental health, physical, social, emotional, intellectual, spiritual, all these together forms the health of a woman. So regular physical activity has a very important role for leading a healthy lifestyle. So first, before talking about that, first you should know what is physical activity. So according to the World Health Organization, physical activity is any body movement produced by the skeletal muscles that requires energy expenditure. Okay, so according to the recommendations, for all adults of age 18 to 64 years, at least 150 to 300 minutes of moderate intensity physical activity is required, or 75 minutes of vigorous intensity physical activity per week. So that accounts for about 30 minutes per day. So there comes the importance of physical activity. And exercise will improve the cardiovascular fitness of the individual, and it will improve the mental health, improve the bone health, as we all have discussed here. So today, I'm Dr. Amrita Vishwanath, and I have Dr. Nandana here. We are from the Department of Physical Medicine and Rehabilitation. So we will be giving a small training session for you all, that if any woman at home can do these exercises. So we have included actually 4 types of exercises. That includes the endurance training exercises, then resistance training, that includes the strengthening exercises, flexibility exercises, and the balance exercises. Okay, so we'll start. Dr. Nandana will join.
Good afternoon, everyone. I'm Dr. Nandana, President from Physical Medicine and Rehabilitation. So this is exercises that not just for women, but anyone can do with very minimal equipment. അപ്പോൾ അധികമൊന്നും ഇല്ലാണ്ട് വീട്ടിൽ ഒരു വെയ്റ്റ്സും ഒന്നും ഇല്ലാണ്ട് ഒരു മാറ്റും വേണമെന്നില്ല, നമുക്കിപ്പോൾ ചെയ്യാനും എല്ലാവർക്കും പറ്റുമെങ്കിൽ ഒന്ന് എണീറ്റ് നിൽക്കുമോ? റെഡി അല്ലേ? എല്ലാവരും ആക്റ്റീവ് അല്ലേ? ഓക്കെ.
സെഷൻ ഉണ്ട്.
സോ ആദ്യം നമുക്കൊന്ന് വാമപ്പ് ചെയ്യാം. സോ ഫസ്റ്റ് നിൽക്കുന്നിടത്ത് നിന്ന് തന്നെ ജസ്റ്റ് ഒന്ന് ഹാർട്ട് റേറ്റ് ഒന്ന് കൂട്ടാനായിട്ട് ജസ്റ്റ് ഒന്ന് ഓടിക്കോ. റൺ ഇൻ പ്ലേസ്. വെരി ഗുഡ്. ഓക്കെ, പിന്നെ സ്ഥലമില്ല എന്നറിയാം, ബട്ട് ഇഫ് യു ക്യാൻ അപ്പ്. ഗുഡ്. റൺ. And up. Okay, good. അപ്പോൾ ഒന്ന് വാംഡ് അപ്പ് ആയി, നമുക്ക് ഹാർട്ട് റേറ്റ് ഒന്ന് കൂടി. Now let's start stretching all our muscles, all our joints. Okay, neck up and down. 1, down. 2, 3, down. 4, 5, 6, 7, 8, 9, 10. Good. Side to side. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Good. Any arms. Back-iloട്ട്. 1, 2, ആരെയും ഇടിക്കില്ല. 3,
രണ്ട് കൈയും
4,
ഷോൾഡർ റൊട്ടേഷൻ ഫോർവേഡ് ആൻഡ് ബാക്ക്വേർഡ്. Okay.
5,
both shoulders.
6, 7, 8, 9, 10. Good. Now forward. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Good. Wrist
Circles.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Now reverse. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Good.
Hip rotation.
Hips. Ready? Okay. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Reverse. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Good.
Ankle circles.
Ankles. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Reverse. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Other side. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Reverse. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Okay. ഇനി നമുക്ക് സ്റ്റാർട്ട് ചെയ്യാം.
ജാനുമാം പറഞ്ഞ പോലെ നമുക്ക് ഒരു ബോട്ടിൽ മതി, 1 ലിറ്റർ ബോട്ടിൽ വെച്ച് സ്ട്രെങ്തനിങ് എക്സസൈസ് നമ്മൾ ഈസിലി അവൈലബിൾ ആണ്. വീട്ടിൽ നിന്ന് തന്നെ ഒരു 1 ലിറ്റർ ബോട്ടിൽ ഉപയോഗിച്ചാൽ മതി, ബോത്ത് സൈഡ്സ്.
ആദ്യം പുള്ളി ഓക്കെ. ഫസ്റ്റ് ആൻഡ് ഫുൾ. ഒരു ബാക്ക് ടൈറ്റ് ആവണം. 1 more. 2. 1 more. 3. Good. 4. 5. 6. 7. 8. 9. 10. Good. Knee arms. Ready? 1.
Arm circles.
4, 5, 6, 7, 8, 9, 10. Reverse. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Good. If you have any bottle, ഇല്ലാന്നറിയാം, എന്നാലും വീട്ടിലൊക്കെ ബോട്ടിൽ എന്തെങ്കിലും മിനിമം എക്വിപ്മെൻറ്റ് വെച്ചിട്ട് 2 സൈഡിൽ ഇങ്ങനെ വയ്ക്കാം. പുഷ്. 1, 2, 3. കുറേ പേര് ക്ഷീണിച്ചെന്ന് തോന്നുന്നു. 4, 5, 6, 7, 8, 9, 10. ഓക്കെ. ക്ഷീണിച്ചോ അതിൻ്റെ ഇടയ്ക്ക്? ഇല്ല? ഓക്കെ, എന്നാൽ ജമ്പിങ് ജാക്സ്. സ്റ്റാർട്ട്.
Jumping jacks.
1, 2, 4, 5, 6, 7, 8, 9, 10. Good.
Knee to elbow, knee to elbow.
ഓക്കെ. ഇനി അടുത്ത് നമുക്ക് ആബ്സ്, കോറ് കുറച്ച് വർക്ക് ചെയ്യാം. നീ ടു എൽബോ. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Sit to stand squat.
യാ. പിന്നെ അടുത്ത് നമുക്ക് ലെഗ്സും ചെയ്യാം. ഇപ്പോൾ ഒരു ചെയർ ഉണ്ടെങ്കിൽ ചെയറിന്ന് സിറ്റ്, നീസ് ഒരു ഷോൾഡർ ഡിസ്റ്റൻസ് അപ്പാർട്ട്, എങ്ങും പിടിക്കാണ്ട്. ചെറിയൊരു സപ്പോർട്ട് ആവശ്യമുണ്ടെങ്കിൽ ചെയ്യാം.
ബാലൻസിന് ഇഷ്യൂസ് ഉള്ളവർക്ക് സപ്പോർട്ട് ചെയ്തിട്ട്
ആൻഡ് സ്റ്റാൻഡ്.
സിറ്റ് ടു സ്റ്റാൻഡ്.
ആ ചെയർ പറ്റൂല എന്നറിയാം. വിത്ത് സ്റ്റാൻഡ്. ഇങ്ങനെ ഓർ ഓക്കെ ആണെങ്കിൽ ചെയറിൻ്റെ ആവശ്യമില്ലാണ്ട്
You can hold like this.
ഇങ്ങനെ സിറ്റ് സ്ക്വാട്ട്. കുറേ അവിടെ തുടങ്ങി എല്ലാവരും സ്ക്വാട്ട്. 2 3 4 5 6 7 8 9 10. ഓക്കെ, ക്ഷീണിച്ചോ?
ഉള്ള എക്സസൈസ് കുറച്ച് കിടന്നിട്ടുള്ളതാണ്. അത് ജസ്റ്റ് ഡെമോൺസ്ട്രേറ്റ് ചെയ്യും. അത് നിങ്ങൾ വീട്ടിൽ കണ്ടിന്യൂ ചെയ്താൽ മതി.
എല്ലാവരും ടയേർഡായോ? ഇല്ല, ഒന്നുകൂടി ചെയ്യണോ? ആണോ? ഓക്കെ, നമുക്കൊന്ന് കൂൾ ഡൗൺ ചെയ്യാം. അതുകൊണ്ട് ഒന്ന് ലൂസ് ആവണം. ഒരു ഡീപ്പ് ബ്രെത്ത് എടുക്കുക. ഹോൾഡ് 1 2 3 4. ബ്രീത്ത് ഔട്ട്. ഡീപ്പ് ബ്രെത്ത് ഇൻ. ഹോൾഡ് 1 2 3 4. Breathe out. One more time. Breathe in. Hold 1 2 3 4 and breathe out. ഇനി ഒന്ന് സ്ട്രെച്ച് ചെയ്ത്
അപ്പർ ബാക്ക് സ്ട്രെച്ച്.
ഓക്കെ, ഫ്രണ്ടിലോട്ട്. ഓക്കെ,
അപ്പർ ചെസ്റ്റ് സ്ട്രെച്ച്. And side stretch.
Side. 1 2. ഓക്കെ, ഇവിടുത്തെ കഴിഞ്ഞു. ഐ ക്യാൻ ടീച്ച് കുറച്ചുകൂടെ എക്സസൈസ്. നമുക്ക് വീട്ടിലൊരു മാറ്റോ കിടന്നിട്ട് ഈവൻ രാത്രി കിടന്നിട്ട് ചെയ്യാൻ പറ്റുന്ന കുറച്ച് എക്സസൈസസും കൂടെ പറയാം. എസ്പെഷ്യലി ഫോർ വിമൻ. ബാക്കും കോറും ഒന്ന് സ്ട്രെങ്തൻ ആക്കാനുള്ള എക്സസൈസസ് ആണ്. കാണൂല? കാണാമോ? ഓക്കെ ഓക്കെ, ഇവിടെ വന്ന് ചെയ്യാം. ഇപ്പൊ കാണൂലേ? കാണൂലേ?
ലെഗ് റേസ് എക്സസൈസ്.
ആദ്യം ലെഗ് റേസ്. ഹാൻഡ്സ് സൈഡിലാവണം. ഇത് ചെയ്യാൻ പറ്റാത്തവർക്ക് ഒരു ലെഗ് താഴെ വെച്ചോ. ആൻഡ് അപ്പ്. ഓക്കെ, പിന്നെ അടുത്ത എക്സസൈസ്. ലെഗ്സ് ഒന്ന് ബെൻഡ് ചെയ്ത് വെക്കണം. ഗ്ലൂട്ട് and hands to the side, up.
Bridging exercise.
പക്ഷെ എല്ലാം സ്ലോ ആയിട്ട് ചെയ്യണം. ഹോൾഡ് ചെയ്യണം. ഓക്കെ, പിന്നെ നമുക്ക് തിരിഞ്ഞിട്ട്
plank exercise.
പ്ലാങ്ക് എക്സസൈസ്, കോർ സ്ട്രെങ്ത്തിന്. Your hand has to be in line with the shoulder. ഇങ്ങനെ. ഇപ്പോൾ ഫ്രണ്ടിലോട്ടും അല്ല ബാക്കിലോട്ടും അല്ല, ഇവിടെ. ആൻഡ് ഇത് പാടാണെങ്കിൽ ഈ പൊസിഷനിൽ വന്നിട്ട് നീ ഒന്ന് ബെൻഡ് ചെയ്താൽ മതി. സോ എവ്രി വൺ ക്യാൻ ഡു ദിസ്. പിന്നെ നമുക്ക് ചെയ്യാൻ പറ്റുന്നത് ബാക്കിൻ്റെ സ്ട്രെങ്ത്തിനുള്ളൊരു എക്സസൈസ്. കിടക്കുക, ആംസ് അപ്പ്, ഹെഡ് അപ്പ്. ജസ്റ്റ് ഇങ്ങനെ ഹോൾഡ് ചെയ്യണം. ഇവിടുത്തെ മസിൽ ടൈറ്റായിട്ട് ഹോൾഡ് ചെയ്യണം. കുറച്ചുകൂടെ ഹാർഡാക്കാൻ ഇൻ ഫ്രണ്ട്. നെക്സ്റ്റ് കുറച്ചുകൂടെ ഹാർഡാക്കാൻ ലെഗ് അപ്പ്. ഓക്കെ, ആൻഡ് ഇതെല്ലാം നമ്മൾ ഹോൾഡ് ചെയ്യണം. അപ്പോൾ ഈ ബാക്ക് എക്സ്റ്റൻഷൻ ആണെങ്കിലും 1 മിനിറ്റ് ഹോൾഡ് ചെയ്യാം. പ്ലാങ്ക് 1 മിനിറ്റ് ഹോൾഡ് ചെയ്യാം. അത് കൂട്ടി കൂട്ടി കൊണ്ടുവരണം. ഓക്കെ, പിന്നെ ജസ്റ്റ് ഒരു സ്ട്രെച്ചും കൂടി കിടന്നുകൊണ്ട് ചെയ്യാൻ പറ്റുന്ന ഇവിടുത്തെ ആബ്സ് ഫുള്ളൊന്ന് സ്ട്രെച്ച് ആവും. പിന്നെ ഫീമെയിൽസിന് ഈവൻ പീരിയഡ് പെയിൻ അങ്ങനെ എന്തെങ്കിലും ഉണ്ടെങ്കിൽ ലെഗ്സ് ഇങ്ങനെ അടുപ്പിച്ച് വെച്ച് ഇങ്ങനെ ജസ്റ്റ് സ്ട്രെച്ച് ഔട്ട്. ഓക്കെ. ആൻഡ് ഇപ്പോൾ ഞാൻ കാണിച്ച എല്ലാ എക്സസൈസസ് ഒരു പ്രാവശ്യമേ ചെയ്യിപ്പിച്ചിട്ടുള്ളൂ, 10 എണ്ണം. ശരിക്കും ഓരോന്ന് 10 വെച്ചിട്ട് 3 പ്രാവശ്യമെങ്കിലും ചെയ്യണം. ഓക്കെ.
Hope this session was useful to everyone. വീട്ടിലെല്ലാവരും ഇത് കണ്ടിന്യൂ ചെയ്യണം.
എന്തെങ്കിലും ഡൗട്ട്സ് ആൻഡ് സ്പെസിഫിക് ക്വസ്റ്റ്യൻസ് ഉണ്ടെങ്കിൽ വി ആർ ഹാപ്പി ടു ആൻസർ. എനിത്തിങ് റിലേറ്റഡ് ടു എക്സസൈസസ്, ഫിറ്റ്നസ്, ഇത് ചെയ്യാൻ പറ്റുമോ അത് ചെയ്യാൻ പറ്റില്ലേ, എന്താണെങ്കിലും ചോദിച്ചു. ഡൗട്ടൊന്നുമില്ല? ബാക്ക് പെയിൻ ഉള്ളവർക്ക് ചെയ്യാൻ പറ്റുമോ? പറ്റും. അപ്പോൾ ഈ ഞാൻ കിടന്നുകൊണ്ട് കാണിച്ച എക്സസൈസസ് ബാക്കിലോട്ട് ഒരുപാട് സ്ട്രെയിൻ വരില്ല. ആക്ച്വലി നമ്മൾ സിറ്റിംഗ് പൊസിഷൻ, സ്റ്റാൻഡിങ് പൊസിഷൻ, അതൊക്കെ ബാക്കിന് ഭയങ്കര സ്ട്രെയിൻ. അപ്പോൾ കിടന്നുകൊണ്ട് ഈ എക്സസൈസ് ബാക്കിൻ്റെ ആ മസിൽസിനൊന്ന് സ്ട്രെങ്തനെയാണ്. അപ്പോൾ ബാക്ക് പെയിൻ വരുന്നത് ഇസ് ബിക്കോസ് നമുക്ക് മസിൽ സ്ട്രെങ്ത് ഇല്ലാതെ ആ സ്പൈനിലോട്ട്, നട്ടലിലോട്ടാണ് ഫുള്ള് ഫോഴ്സ് പോകുന്നത്. അപ്പോൾ നമ്മൾ ഇങ്ങനെ കിടന്നുകൊണ്ടോ മസിൽ സ്ട്രെങ്ത് കൂട്ടിക്കഴിഞ്ഞാൽ സ്പൈനിലോട്ട് അധികം ഫോഴ്സ് വരില്ല. അപ്പോൾ നമ്മൾ ചെയ്യണം എന്നാണ്. ബാക്ക് പെയിൻ ഉള്ളവർ പ്രത്യേകിച്ചിട്ട് ഈ എക്സസൈസസ് ചെയ്യണം. അവിടെ ഒരു ഡൗട്ട് ഉണ്ടെന്ന് തോന്നുന്നു. അത് ചെയ്യാൻ പറ്റുമെന്ന്. അപ്പോൾ ആ എക്സസൈസ് ഓൾസോ നമുക്ക് ആ പെയിൻ വരാത്ത പോയിന്റ് വരെ ചെയ്യണം എന്നാണ്. എന്നിട്ട് ഓരോ പ്രാവശ്യം ഓരോ ദിവസം അതൊന്ന് കുറച്ച് കൂട്ടണം. അപ്പോൾ ഈ സൈഡിലോട്ട് പെയിൻ ഉണ്ടെങ്കിൽ ജസ്റ്റ് ആ സൈഡ് വരെ ഒന്ന് പോവുക, ഹോൾഡ് ചെയ്യുക, ഡീപ് ബ്രെത്ത്, ആൻഡ് കുറച്ചുകൂടെ ഒന്ന് പുഷ് ചെയ്താൽ മതി. ഓവർ സ്ട്രെയിൻ ചെയ്യണ്ട, ബട്ട് എല്ലാ ദിവസവും ഒരു ചെറിയ ഇമ്പ്രൂവ്മെൻറ്റ് വേണം.
അക്യൂട്ട് സ്റ്റേജിലാണ്, അക്യൂട്ട് ബാക്ക് പെയിൻ ഓർ അക്യൂട്ട് നെക്ക് പെയിൻ ആണെങ്കിൽ ആ സമയത്ത് എക്സസൈസ് ചെയ്യാൻ പാടില്ല. ആദ്യം ഇവാലുവേറ്റ് ചെയ്യണം. ഇവാലുവേഷൻ ഒരു ഡോക്ടറെ കാണിച്ചിട്ട് മാത്രമാണ് അത് എക്സസൈസ് സ്ട്രെങ്തനിങ് വേണമെന്ന് അവർ പ്രിസ്ക്രൈബ് ചെയ്യും. ആ സമയത്ത് മാത്രം എക്സസൈസ്. ബാക്ക് പെയിൻ ഉള്ള പേഷ്യൻസിന് നമുക്ക് എക്സസൈസ് ചെയ്യണം, പക്ഷേ ആദ്യം ഒരു ഇവാലുവേഷൻ ചെയ്യണം, എന്നിട്ട് മാത്രമേ ചെയ്യാൻ പാടുള്ളൂ.
Okay, thank you.
Thank you. It was really a nice session. As we come to the close of this remarkable event, I would like to invite Dr. Priya Nair, Clinical Associate Professor, Department of Gastroenterology, for expressing vote of thanks. Welcome, ma'am.
I think Sarita madam has already kind of thanked everybody in the beginning when we had the initial inaugural session. But at the outset, I would like to start by offering my humble pranams to Amma. Amma, being the founder and the chancellor of this organization, has blessed us with such a fertile ground to be able to hopefully benefit society in more and more ways as time goes by. I would like to express our heartfelt gratitude to the medical director, Dr. Prem Nair, and to the entire hospital administrative team, including Pradhapan sir, who had joined us today, for it was their support and their vision that helped us to make this particular clinic a success, and I hope that though this is a small start, we can take it forward in a big way. I would like to again offer my most sincere gratitude to Sheila madam for coming all the way from Ooty. She has an extremely busy clinical setup. Obviously, aside from her busy obstetric and gynecology practice, she has poured her heart and soul into lifestyle medicine. I think one thing that all of us should try to emulate is the fact that she lives what she tries to train her patients. And for all of us, I'm hoping it's not only the group of clinicians that are sitting here, but also I hope that we can inspire our students, at least some of you, to take this up, because ultimately this is the future of medicine. And to start taking it up, we have to first implement these practices in our own life. So I hope that we can get inspiration, take inspiration from Madam's life, and hopefully some of us will be part of this movement in the future. I also would like to express my gratitude to Jebi Madam, who had come here, like Ma'am said, just before the elections, to all the senior professors and HODs who graced this occasion. I don't need to say thank you because they are part of our entire family and team, but Radhamani Madam, PG Madam, Madhumita Madam, Bindu Madam, and our entire team, including Nisha Ma'am, Janu Madam, and everyone else, Lakshmi, and Nivedita ji, and our clinical psychology team, who unfortunately could not be here at this particular moment, but they have been a driving force behind everything until this point. I also would like to specifically thank our physical medicine and rehabilitation team. They are also part of the Pratheeksha clinic, and they also came here today to give us an energizing session on on a few exercises that we can do at home. My gratitude to the entire audiovisual team for their support, to the pantry team, the kitchen, Swami Karunamrita Prana, who came not only for the puja, but she's going to feed us now after this closing. So I thank all of them as well. Thank you to each and every one of the staff who have come here, a lot of the nursing staff, all our nursing senior, entire faculty sitting here. And we all know that more than we have interaction with the patients, it has always been and always will be the nurses that are the face of the hospital to patients. So I really hope that as a team between doctors, nurses, the entire allied health sciences team, we can take this forward. We don't always need to be an expert in lifestyle medicine, but even the one patient that while they're in hospital that we can make a small change in their life, that also will go a very, very, very long way. So also thank you to Ardra, thank you to all the physician assistants, to all the administrators, junior and senior, that helped us through this entire process. And last but not the least, the firecracker leader of all of this, Sarita Madam. She drags us at all times of the day and night, reminding us, no, we have to get this started. This is not only my dream and vision, but I'm going to make it your dream and vision as well. So I have to express my deepest gratitude to Sarita Madam, and I hope that we can all together with her endless enthusiasm and excitement, we can take this forward. So thank you to all. Om Amriteshwari Namaha.
Thank you, ma'am. As we conclude this launching event, let us remember that the work does not end here. It's only the beginning. Together, let us continue to strive forward, and our goal of ensuring good health to every woman in our community. Thank you once again to everyone who has made this day possible. May this Pratheeksha become the strong hope and healing for everyone. After an engaging and insightful morning, it's time to refuel our bodies. We arranged the lunch for everyone, which is served out next to this auditorium. Good and great company together. Thank you for everything.